The trauma room went dead silent when she grabbed the surgeon's wrist. Not because she was loud, not because she was angry, because her voice was so calm it cut through the chaos like a blade through silence, and every monitor in the room agreed with her. "If you make that incision," she said, "he dies in 4 minutes." The surgeon looked at her like she was nobody, like she was furniture in scrubs. Then the Marine's pressure crashed to 60 over nothing, and the room started screaming. She was already moving. By the time anyone understood what was happening, her hands had done what 12 years of battlefield medicine had trained them to do, and the Marine was still breathing. 3 minutes later, a military helicopter landed on the roof, and everything changed. Before we go any further, if you're new here, hit that subscribe button right now, because this channel is where ordinary people discover extraordinary stories, and I promise you do not want to miss what's coming next. Drop a like on this video, and tell me in the comments what city or country you're watching from. I want to see exactly how far this story travels. Now let's get into it. Her name was Nora Voss, and she arrived at Callaway Defense Medical Center on a Tuesday morning in late October, which was the kind of morning that couldn't decide whether it wanted to be fall or winter. The sky over Hargrove Bay, Virginia, was a flat gray. The wind off the water had teeth in it, and the parking lot smelled like diesel and dead leaves. She pulled her truck into the last available spot in the employee section, a compact space between a Mercedes and a pickup with a Callaway CMC parking placard in the window, and sat there for a moment with the engine running, not because she was nervous. Nora Voss hadn't been nervous about a job in a long time. She sat there because she was making a decision she made every single morning, the same decision she'd been making for 2 years. Leave it at the door. Leave the other life at the door. Walk in as a nurse, just a nurse. She turned off the engine. The canvas bag she carried was old enough that the handles were soft with wear. The fabric faded from olive to something closer to sand. Inside, a change of clothes, a stethoscope she'd owned for 9 years, a granola bar she probably wouldn't eat, and a folded letter from the Virginia State Board of Nursing confirming her credentials. She didn't carry anything else. There was nothing else worth carrying into a civilian hospital. Callaway Defense Medical Center was a Level Y trauma facility that served both the local population of Hargrove Bay and the surrounding military installations. It had 340 beds, a dedicated trauma bay, a surgical suite that ran 3 rooms simultaneously during peak hours, and a reputation that the people who worked there maintained like a religion. The staff had been told a transfer nurse was coming from a smaller facility up the coast. They had not been told much else, because there was not much else in Nora's personnel file that a standard hospital clearance would pull up. The things worth knowing about Nora Voss existed in documents that required a different kind of access entirely. She didn't think about that as she pushed through the main entrance. What she thought about was the locker combination she'd been given, and whether the break room had decent coffee, and whether the day-charge nurse would be the kind of person who explained things once and trusted you, or the kind who explained things 3 times and still watched over your shoulder. The answer to that last question came faster than she expected. The trauma bay orientation was scheduled for 8. By 7:55, Nora had found her locker, changed into her blue scrubs, clipped her ID badge to her chest, Voss, N, RN, and was standing at the edge of the trauma bay doorway with her hands in her pockets, taking inventory the way she'd always taken inventory, quietly, systematically, without appearing to do it at all. The room was well equipped. 3 bays separated by curtain tracks, crash cart positioned correctly, defibrillator charged and accessible, supply cabinets organized and labeled. 2 nurses she didn't know yet were rechecking a medication tray near Bay 2. A resident was reading something on a wall-mounted tablet with the focused expression of someone who had been awake since 4 in the morning and was using concentration as a substitute for sleep. What she noticed, because she noticed everything, was that the supply cabinet labeled Airway had a lock that didn't quite close flush with the frame. It would stick under pressure. In an emergency, with adrenaline doing what adrenaline did to fine motor control, that cabinet would cost someone 3 seconds. 3 seconds in a trauma bay was not nothing. She filed it away. "You're the transfer." The voice came from behind her, and it wasn't a question. It was the kind of statement that wore a question's shape but carried a verdict inside it. She turned. The man standing in the trauma bay entrance was tall, somewhere in his mid-50s, with the kind of posture that announced authority before the face did. Dr. Reardon Holt, Chief of Trauma Surgery. She knew his name from the facility orientation packet. She knew his CV too, because she'd looked it up the way she looked up everything, thoroughly, without advertising the fact. Holt had done his residency at a prestigious program in Baltimore, had 17 years at Callaway, and had published extensively on hemorrhagic shock management. He was also, based on 3 seconds of observation, the kind of man who had been the smartest person in most rooms he'd entered for so long that he'd stopped checking whether that was actually true. "Nora Voss," she said. "Yes." He looked her over in a way that was technically professional and actually something else. The kind of assessment that measured competence by appearance and made up its mind before any evidence arrived. "You're from Pelham Coast Regional." 8 months at Pelham Coast. Before that, a different kind of work. "What kind?" "Medical transport support. Mostly field adjacent." The way she said it was true, and told him almost nothing. He didn't push. He didn't seem particularly interested in the answer. "We run a tight trauma bay," he said. "I don't have time to walk anyone through our protocols more than once. If you miss something, you ask. You don't improvise, you don't freelance, and you don't make calls above your scope. Clear?" "Clear," she said. "Good. You'll be with Jacinda Morrow today. She'll show you the workflow." He glanced at her badge, then back at her face, with the expression of someone mentally filing her in a category he'd already chosen. "Just keep your head down and do your job." He walked away before she had a chance to respond, which was probably intentional. She watched him go, then looked back at the airway cabinet with the misaligned lock. She'd find the facility manager before lunch. Jacinda Morrow was 34, had been at Callaway for 6 years, and was the kind of nurse who'd seen enough to stop being impressed by most things, but who had the particular gift of not letting that make her unkind. She showed Nora the workflow the way someone shows a new neighbor around the block. Efficiently, practically, with the occasional unfiltered editorial comment. "Bay 3 is always the problem bay," Jacinda said, walking her through it. "The monitor in there has a lag on the oxygen saturation display. Nobody's fixed it yet. Maintenance says it's on the list. It's been on the list for 4 months, so you watch it and you subtract about 8 seconds mentally." "Got it." Holt likes everything verbalized before you do it. Every step. It's not because he thinks you'll mess up, it's because he's... She paused, chose her words. "He's built a very specific ecosystem in here, and he likes hearing it run the way he designed it." "Understood." Jacinda looked at her sideways. "You're not asking a lot of questions." "I'm listening," Nora said. "Questions come after I know what I don't know yet." A beat. Jacinda seemed to recalibrate slightly. "Okay," she said. "Let's go over the medication cart." By noon, Nora had a working map of the department in her head. She'd also quietly notified the facilities desk about the airway cabinet, introduced herself to the 2 nurses she'd seen earlier, Daly and Prescott, both competent, both reserving judgment about her, and handled 2 non-critical admissions without incident. A 42-year-old contractor with a laceration to his forearm from a table saw. An elderly woman with an elevated heart rate and confusion who turned out to have a UTI that had gone untreated long enough to become something that looked scarier than it was. Straightforward, manageable, the kind of shift that let you settle in. And then Dr. Holt stopped by to review her documentation on the second patient, and something shifted. "This notation," he said, pointing at her electronic chart entry. "You flagged a possible medication interaction." The patient's home medication list included metformin. She was presenting with some confusion and an elevated lactate on the initial panel. "I flagged it as worth ruling out lactic acidosis before attributing everything to the UTI." The attending already made the call. "I know, I wasn't second-guessing the call. I was documenting a differential for the record." Holt looked at her with an expression that was harder to read than annoyance. It was closer to the look someone gave when they'd expected less and weren't sure yet how to feel about getting more. "You're a transfer nurse," he said. "Yes." "From a coast facility?" "Yes." "And you're flagging differentials in your documentation." "I flag what I see," she said. "That's the job." He didn't respond. He handed her tablet back and walked away, and this time she couldn't tell if the way he left was dismissal or something else. Jacinda appeared at her elbow approximately 45 seconds later. "What did you say to him?" "I documented a differential." Jacinda stared at her. "On day 1. Was that wrong?" A pause. "No," Jacinda said carefully. But Holt has a very specific idea about what nurses document and what doctors document, and those categories don't overlap as much as they should. She paused again. Where did you actually work before Pelham Coast? Nora picked up the next patient chart. Medical transport support, she said. Come on. Bay 1 is flagging. The first 2 weeks established the pattern. Holt assigned her to the lower acuity end of the trauma bay. Routine monitoring, documentation, medication administration, the kind of work that a competent nurse could do correctly and a good nurse could do without thinking. She did it without complaint. She asked her questions in the order that made sense. She learned the rhythms of the department the way she'd learned the rhythms of every environment she'd ever worked in. Not by asking people to explain them, but by watching until she understood them from the inside. The rest of the staff sorted themselves into 3 groups, the way they always did. The ones who were waiting to see what she was made of. Jacinda was in that group, and Daly, and a nurse tech named Obafemi, who had the watchful quality of someone who'd been surprised before and wasn't in a hurry to be surprised badly again. The ones who had already decided, 2 senior nurses named Bartlett and Crane, who had been at Callaway long enough to have developed opinions about new staff, the way old Wood developed opinions about the weather, and whose opinions of Nora were not favorable. And the ones who didn't care yet, which was most of the residents. Bartlett said it on day 8, in the break room, in a voice that was just loud enough to carry. Transfer nurses from small facilities always think they know more than they do. She'll either figure out she's out of her depth, or Holt will figure it out for her. Crane said, quieter, but not quiet. Did you see how she charted on that UTI patient? Flagging differentials. On a UTI. She's going to be a problem. Nora was at the coffee maker. She poured her coffee, put the carafe back, and walked out. She'd been called worse things by people with better reasons, and in places where the consequences of losing her composure were a lot more serious than a bad shift. What she felt was not hurt. It was closer to a very tired kind of patience, the patience that comes from knowing something about yourself that you can't explain to anyone who isn't ready to hear it, and knowing that the explaining will either happen on its own or not happen at all, and being at peace with both outcomes. She went back to work. On day 12, Dr. Reardon Holt made his position explicit. He called her into his office at the end of her shift, a small, windowless space stacked with journals and research papers, with a whiteboard on one wall that had a trauma protocol flowchart drawn in red marker and never erased. He sat behind his desk with his hands folded on top of it, which was the posture of a man who had decided what he was going to say before she entered the room. I've been reviewing your work, he said. Okay. You're competent, I'll give you that. Your skills are solid, your charting is clean, your patient interactions are professional. She waited. The but was coming the way weather was coming, visibly, from a distance. But you have a habit that concerns me, he said. You observe above your scope. I've had 3 different attendings mention it. You flagged a possible tension pneumo on a patient in Bay 2 before the attending had completed his assessment. The trachea was deviating, she said. I mentioned it. The attending was in the process of assessing. The deviation was progressing while he assessed. Holt's jaw tightened. That's not your call to make. I know the boundaries of my scope, she said. I didn't make a call. I communicated an observation. The attending made the call. The way you communicated it was direct, she said, because the window was narrow. A silence settled between them that had some weight to it. You're a nurse, Holt said, and the way he said it meant something that the words technically didn't say. You have a role in this department. That role is to support, to monitor, to communicate within the appropriate chain of command, and to execute. It is not to second-guess physicians or to position yourself as a clinical decision-maker. She looked at him for a moment. If I see something that will kill a patient if it's not addressed in the next 30 seconds, what do you want me to do? I want you to communicate it through the appropriate channel. Which takes how long? His expression shifted. I'm not being difficult, she said. I genuinely want to know the protocol, so I follow it correctly. If the appropriate channel takes 45 seconds and the window is 30, what's the procedure? He didn't answer immediately, which told her something. You're a transfer nurse from a small coastal facility, he said finally, and the way he said it was the closing of a door. Act like it. Is that clear? She looked at him. Clear, she said. But she was already thinking about the airway cabinet that facilities had finally fixed that morning, about the monitor lag in Bay 3 that was still on the list, about the 12 patients she'd seen in 2 weeks, and the 3 things she'd caught that no one else had caught yet. She picked up her bag and walked out. The morning of October 28th was when everything broke open. She was 40 minutes into her shift when the trauma line rang. Bay Charge took it, and within 15 seconds the pace of the department changed the way air pressure changes before a storm. Not dramatically, but noticeably, if you were paying the right kind of attention. Multi-vehicle, Daly called out. Military convoy, Route 9 bypass, 8 miles out. We've got 3 incoming critical, 2 urgent, 1 walking wounded. ETA 11 minutes. The trauma bay mobilized the way it had been built to mobilize. Holt was there in 4 minutes, which meant someone had called him at home, or possibly he was already in the building. Residents and attendings took their positions. Nurses moved to their assigned roles. Nora was assigned secondary monitoring. Bay 3. She took the position and said nothing, but she was watching everything. The first 2 patients arrived together. Both Marines, both with blast pattern injuries, both managed efficiently by the attending teams. The trauma bay moved with a kind of controlled intensity that was impressive to watch. Holt was good in crisis. She gave him that. His decisions were fast, his communication was clear, and he didn't waste motion. The third patient arrived 7 minutes after the first 2. He came through the doors on a gurney at speed, pushed by 2 EMTs who were already talking over each other. Marine, mid-20s, the EMT report was GSW to the left shoulder, secondary trauma to the chest wall, BP 88/60 on arrival, heart rate 124, oxygen saturation 91 and falling. He was conscious. He was trying to talk. His name, the medic ID on his collar, was Corporal T. Brower. Holt moved to him immediately. Nora moved too, to her assigned position at the monitoring station, and she started doing what she was there to do. She watched the numbers, tracked the changes, kept the documentation current in real time. And she saw something. It wasn't in the numbers first. It was in the way Corporal Brower was breathing, the quality of it, the mechanical effort, the slight asymmetry that the monitoring equipment wasn't calibrated to flag as an independent variable. She'd seen that breathing pattern before. In a place she wasn't supposed to talk about, in conditions she wasn't supposed to describe. Holt was assessing the shoulder wound, which was bleeding heavily and was the obvious injury, the injury that announced itself. I was talking through his findings, calling for imaging, directing the resident. Nora looked at the chest X-ray that came up on the wall screen. She looked at Brower's neck. She looked at the saturation reading, which had dropped to 89. Dr. Holt. I'm assessing, he said without looking up. Left side breath sounds are diminished. I'm aware of the chest wall trauma. The trachea is shifting right, she said. Not much, but it's shifting. A half-second silence. Holt looked at the monitor, then at the patient's neck. The shift was subtle, the kind of thing you caught if you were watching the right thing at the right moment. It's artifact, he said. We'll get a repeat film. The saturation dropped to 87. Nora stepped closer to the gurney, not into the physician's space, close enough to see. His left chest isn't moving the same as his right, she said. The wound track from the GSW, if it tracked posteriorly, you could have a tension component building. Saturation is trending down. Heart rate is climbing. Nurse Voss, his voice had gone flat and cold. I did not ask for your assessment. I know, she said. I'm giving it anyway. The monitor sounded, not the steady rhythmic tone of a tracked patient, the escalating 2-note alarm of a deteriorating one. Saturation 84. Heart rate 138. Blood pressure crashing. Holt looked at the screen. Something changed in his face. Not capitulation, not yet, but the crack in certainty that happens when the data stops matching the diagnosis. Nora was already at the patient's left side, her stethoscope in place, listening. Silence where there should have been sound. She straightened. Tension pneumothorax, she said. Left side. He needs immediate decompression. You are not... He has 30 seconds, she said. Maybe less. Brower's eyes were losing focus. His lips were going blue at the corners. His body was shutting down in the organized, terrible way that bodies shut down when they run out of room. The resident at the foot of the bed said very quietly, his neck veins are distending. Everyone looked. The external jugular veins on both sides of Brower's neck were visibly engorged. The classic, textbook, unmistakable sign of obstructed venous return. The sign that said the pressure was real, was now, was fatal if nothing happened in the next few breaths. Holt went still for exactly 1 second. Then, "Get me a 14-gauge needle. Second intercostal space, mid-clavicular line. Now." He performed the needle decompression. The rush of air was audible in the suddenly quiet room. Corporal Brower took a breath that rattled and caught, and then steadied. The saturation climbed. 84, 87, 81. The monitor settled. Brower's eyes focused. The room was very quiet. Holt straightened. He didn't look at Nora. He looked at the wall, at the monitors, at the resident who was now moving with renewed purpose to support the patient's airway. Then he looked at her. The expression on his face was not gratitude. It was not professional acknowledgement. It was something older and harder. The look of a man who had been right about himself for a very long time, encountering evidence that he might not be the only person in the room who mattered. "Finish your monitoring documentation," he said. She nodded. She turned back to her station. Around her, the department was already moving again because trauma bays didn't pause for complicated moments, because there were 2 more patients in the system and a rotation that didn't stop for anything short of a power failure. But she felt the looks, daily, at the wall with a supply cart, watching her with an expression that had changed. Obafemi, near the medication cabinet, giving her a single slow nod that meant something but wasn't going to be said out loud. Even Jacinda, coming through the trauma bay doors with updated vitals on the first patient, pausing just long enough to catch her eye. She looked back at her screen. Corporal T. Brower, 26, Marine Corps, heart rate stabilizing, oxygenation improving, blood pressure climbing back towards something survivable. She finished her documentation. She noted what she'd observed, the timeline, the clinical rationale, the intervention. She documented it accurately and completely because that was what the record required, and because she understood, in the particular way she understood most things, that what went into the record mattered later. An hour after Corporal Brower was stabilized and moved to surgical for his shoulder wound, Dr. Reardon Holt called her into the hallway outside the trauma bay. He stood with his arms crossed and his jaw set, and she could tell from 15 feet away that this was not the conversation she'd been half expecting, the one where he said something uncomfortable that gestured toward acknowledgement. This was a different conversation entirely. "You interfered with my clinical management of a patient," he said. "I communicated an observation. You escalated it past the point of communication. You positioned yourself in the clinical space without authorization. You pressured the team. The patient was dying. I was handling it." She said nothing because there was nothing useful to say to that particular sentence. "I'm filing a formal incident report," he said. "I'm recommending you be removed from trauma bay assignments pending review. You can work general med-surg until the investigation is complete." She looked at him for a long moment. "Is Corporal Brower alive?" she asked. Something moved across his face. "That is not the point." "Okay," she said. "You're not going to fight this?" "No," she said. "Write what you need to write. I'll cooperate with whatever review you initiate." He looked at her with the confused irritation of a man who had expected resistance and didn't know what to do with its absence. "We'll discuss this tomorrow," he said. "Tonight, you're on general floor." She nodded and turned to go. She heard him say, behind her, almost to himself, "Transfer nurses don't just show up knowing that." She kept walking. Jacinda caught her in the hallway near the stairwell, grabbed her arm, gently but with purpose. "He's going to try to bury you in that report," Jacinda said quietly. "You know that." "Probably. You saved that Marine's life." "Holt performed the decompression," Nora said. "His documentation will reflect that accurately." Jacinda stared at her. "Why aren't you angry?" Nora thought about it. Not performing the thought, actually considering the question. "Because I've been in situations where anger was a luxury," she said. "This isn't one of those situations, but the habits stick." Jacinda opened her mouth, closed it. "What did you do before medical transport support?" she asked. Nora looked at her. "Medical transport support," she said. She pushed through the stairwell door. The general floor was quiet that night. 2 post-op patients, 1 cardiac monitoring case, routine rounds, nothing that required the particular set of things that Nora Voss had spent years developing and had spent the last 2 years learning to keep packed away. She did her rounds, she checked her patients, she documented carefully. At 11:45, she was at the nurse's station when the overhead PA system produced a sound she hadn't heard in 2 years, but which her nervous system recognized approximately 3 seconds before her conscious mind caught up. The specific, layered frequency of a military helicopter on approach, not the casual transit tone of a medevac doing a standard hospital run. The deliberate, regulated approach of a specific kind of aircraft on a specific kind of mission. She set down her pen. Through the window at the end of the hallway, she could see the rooftop helipad lighting activate, the amber perimeter lights coming on in sequence, then the central white floods, the configuration reserved for priority landings. Her phone wasn't a military-grade device. She had no access to whatever communications were moving through the installation networks right now. She had no way to know who was on that helicopter or why they'd come to Callaway Defense Medical Center at this hour. But she'd heard that approach tone in a lot of places, and it had always meant the same category of thing. She heard running in the corridor below, the kind of running that meant the emergency was already known to someone in the building. She picked up her pen. Then the overhead PA crackled, and the charge coordinator's voice came through with a professional steadiness that didn't quite cover the edge underneath it. Trauma bay, priority activation, rooftop helipad, all trauma staff to designated positions immediately. And then, after a pause that was less than a second but felt longer, administration, please locate Nurse Voss, N. Nurse Voss to the trauma bay. This is a direct request from the incoming transport team. The pen stopped moving. Around her, the night floor went still. The nurse at the adjacent station looked at her. Obafemi, pulling a double shift, looked at her from the medication room doorway. Nora set down the pen. She'd spent 2 years building a life that was about clean charts and oxygen saturation monitors, and the careful, deliberate process of being only a nurse. She stood up. The PA repeated, Nurse Voss, Trauma Bay, immediately. This is a request from the incoming military transport team. She walked to the elevator. Whatever had just landed on that roof had come looking for her specifically, and there was only one kind of reason that happened, and it had nothing to do with her time at Pelham Coast Regional. The elevator doors closed. The elevator doors opened onto the trauma bay level, and the sound hit her before the visual did. Not the controlled noise of a department in standard activation, but something with a different texture underneath it, the kind of tense, concentrated quiet that happened when people were trying very hard to look like they weren't rattled. She stepped out. The trauma bay entrance was 40 feet ahead, and through the reinforced glass panels on either side of the double doors. She could see the department in motion, the overhead lights on full, crash cart repositioned to Bay 1, 2 attendings she didn't recognize standing near the entrance with the particular stillness of people who were waiting for something specific and trying not to show how urgently they were waiting. What stopped her was the man standing outside the trauma bay doors. Not a doctor, not hospital administration. He was in military uniform, Marine Corps Service B, the working uniform, not dress, with the posture of someone who spent their professional life in rooms that required it. The rank insignia on his collar was Lieutenant Colonel. He had a phone against his ear and was speaking into it in a low, clipped cadence that carried the compressed efficiency of someone delivering and receiving information simultaneously. He saw her the moment she stepped off the elevator. The phone came down. He crossed the distance between them in 7 strides, which was faster than his deliberate pace suggested he was moving. Nurse Voss, he said. Not a question. Yes. He looked at her badge, then at her face, in the way of a man confirming something he already knew. Up close, he was somewhere in his mid-40s, with a jaw that looked like it had absorbed some decisions that didn't go well, and eyes that were doing the same kind of inventory she'd done the morning she arrived at Callaway. Lieutenant Colonel Aaron Driscoll, he said. I'm the senior escort on the incoming transport. We have a critical patient, General Wallace Pruitt, USMC. He collapsed during a command briefing at Stonehaven Installation approximately 90 minutes ago. He's been stabilized for transport, but the situation is moving faster than we'd like. What's his presentation? Driscoll looked at her for half a second, not the look of a man surprised by the directness, but of one confirming that the directness matched what he'd been told to expect. Severe abdominal pain, significant internal bleeding on field ultrasound, BP stabilized with fluids but dropping again during transport. He's conscious but declining. Our field medic suspects a vascular event. History? I have his file. He held out a tablet. But there's something in it I need you to read specifically. The attending here is... Dr. Holt, she said. Dr. Holt has been briefed on General Pruitt's arrival. He has not been briefed on all the relevant background. That briefing is what I'm doing now. He paused. With you. She looked at the tablet he was still holding out. She took it. The file was partially classified, which she could tell not because of any marking on what she could see, but because of the shape of what was missing. The gaps where the language jumped forward in time without explaining the interval. The way certain dates were present and others were represented only by mission reference codes. She'd read documents like this before. She understood the grammar of them. What she could read was enough. General Wallace Pruitt, 61, USMC, 3 combat deployments, 2 classified operational commands, multiple commendations. Medical history, a coronary event 4 years ago, managed with medication. Abdominal surgery 18 months ago. And here the file got specific in a way that made her stop reading and look up. He had a vascular graft procedure, she said, 18 months ago. Abdominal aortic. Yes. And nobody at the installation knew to flag this when he collapsed? The personnel who knew his full medical history weren't in the room when it happened. The briefing was a different command group. His regular aide was on leave. Driscoll's expression said what his voice didn't, the kind of ordinary institutional failure that turned into extraordinary consequences. If the graft is compromised, she said, he's not just bleeding, he's on a clock. That's why I'm talking to you instead of waiting for the standard handoff. She handed the tablet back. Why me specifically? Holt is the trauma chief. Driscoll held her gaze. Because General Pruitt asked for you. The hallway felt suddenly specific in a way it hadn't a moment ago. He doesn't know me, she said carefully. He knows someone who knows you, Driscoll said. And that person made a call approximately 40 minutes ago. General Pruitt was conscious enough to hear it and coherent enough to make a request. He paused. He said, and I'm quoting directly, find Voss. She'll know what she's looking at. The overhead PA activated. The helicopter was on final approach. Nora looked at the double doors to the trauma bay. Through the glass, she could see Reardon Holt, who had apparently been told enough to come in, standing with his arms crossed, and the expression of a man who was trying to determine who, exactly, was about to walk into his department and why. You should know, Driscoll said, that Dr. Holt was briefed on the incoming patient. He was not told about this conversation. He's going to be told. Yes, but not before the patient arrives. He looked at the ceiling, a brief, tired gesture. I understand this creates a complicated situation for you. It's fine, she said. Is it? She thought about the incident report sitting in Holt's files right now with her name on it. She thought about Corporal Brower, who was in surgical recovery down the hall. She thought about the 2 years she'd spent learning to keep things packed away and the very specific way those 2 years were apparently ending. It's manageable, she said, which was not the same thing as fine, but was true. The rooftop helipad lights, visible through the high window at the end of the corridor, shifted from amber to white flood. They were down. The trauma bay doors opened, and the controlled chaos of a military medical transport became the controlled chaos of a trauma bay receiving one. And for approximately 90 seconds, the two systems were colliding and sorting themselves out simultaneously. Nora moved to her position at the monitoring station. Her assigned position, the one Holt had confirmed when he saw her come through the doors with Driscoll, and his expression had gone through 3 separate calculations in about 4 seconds. He hadn't said anything yet. That was its own kind of information. General Wallace Pruitt arrived on a military-spec transport gurney, which was sturdier and more complicated than the hospital standard, and the 2 Marine medics managing it were moving with the particular focused intensity of people who had kept someone alive through a helicopter flight and were not going to lose that work in the transfer. Pruitt was conscious, his eyes were open, tracking, but his color was wrong, the gray underneath brown of someone whose body was spending its reserves. He was a large man, broad-shouldered, with the architecture of someone who had been physically powerful for a long time and was being diminished by something he couldn't fight with the equipment that had served him for 6 decades. He looked at her. Across the trauma bay, through the movement and noise and the 2 attendings positioning themselves, his eyes found her and stayed. She gave him a small nod. Clinical, professional. The nod that meant, I see you, I'm here, I'm paying attention. His jaw tightened slightly, which on his face looked like relief. Holt moved to the head of the gurney. General Pruitt, I'm Dr. Reardon Holt, Chief of Trauma Surgery. Can you describe your pain? Pruitt's voice was strained but clear. Abdomen, deep. It's been building for 3 hours. I thought it was the food at the briefing. Then I couldn't stand up. He paused. Breathing cost him something. I had a procedure 18 months ago, vascular. We have your file, Holt said. We'll get imaging immediately. Can you... Where's Voss? Pruitt said. The room absorbed this. Holt's head didn't turn immediately. When it did, the turn was measured. He looked at Nora at the monitoring station, then back at the patient. Nurse Voss is on the monitoring team, he said, with the smooth neutrality of a man keeping something very specific out of his voice. I want her in the room, Pruitt said. I want her at the table. General, I assure you that you're in excellent hands. Doctor. Pruitt's voice didn't rise. It didn't need to. It had the particular quality of authority that wasn't performed. That was just what the voice sounded like when it meant something. I am not questioning your hands. I am telling you what I need. I need Voss in this room, and I need her opinion valued. Can you do that? A beat. Of course, Holt said. He looked at Nora again. This look was different from every look he'd given her before. Not assessment, not dismissal, not the controlled irritation of a man managing an inconvenience. This was the look of a man who was realizing, at speed, that he was missing significant context. She moved from the monitoring station to the primary bay. The imaging came back in 11 minutes, which was fast, and what it showed was not ambiguous. She was looking at the films beside the attending radiologist on the wall screen when Holt came to stand on her other side, and for a moment the three of them were just looking at the same image with the same focused attention, and the situation didn't care about hierarchy. The graft, an aortic endovascular graft placed 18 months ago to address a descending aortic aneurysm, had a visible endoleak, not a small one. The type 2 classification that might have been manageable was edging toward type 1 at the proximal seal zone, which meant arterial pressure was reaching the aneurysm sac, which meant the sac was re-expanding, which meant the repair that was supposed to have solved the problem had developed the particular category of failure where the solution becomes the next emergency. Endoleak, Holt said. Type 1, proximal, she said. Look at the expansion on the SSE compared to his post-operative imaging in the file. That's not new. That's been developing. Holt was quiet for a moment. The file shows a 6-month follow-up with no noted leak. The 12-month imaging isn't in the civilian record, she said. There's a gap. Driscoll said his aide was on leave. Whoever tracked his follow-up schedule might have. The appointment was missed, Driscoll said from the doorway. He'd been standing there for the last 4 minutes, not interrupting, with the manner of someone who understood how much space medical professionals needed to work and had learned to provide it. We found out tonight. He missed his 12-month CT follow-up. It wasn't flagged. Holt looked at the image. His face had the quality of a man doing several things simultaneously inside his own head. He needs endovascular intervention, Holt said. We'll need vascular surgery, and we'll need it now. Dr. Kamani is in the building, the attending radiologist said. I can have her paged. Do it, Holt turned to Nora. What else? The question surprised her, not because it was unreasonable, but because of who was asking it and what it cost him to ask it, and because she'd been in this building for 2 weeks, and this was the first time he'd asked for something from her instead of defining the limits of what she was permitted to offer. She looked at the image again. His pressure has been dropping intermittently during transport. If the SAC is expanding under arterial pressure, the drop pattern suggests he's had brief periods of, not rupture, but microhemorrhage. Small leaks, then tamponade, then release. He's been bleeding and clotting and bleeding again for the last few hours. How long do you think? I don't know how long. I know it's not stable, and I know the next significant bleed might not tamponade. She met his eyes. He needs the OR in the next hour. Holt nodded. Not grudgingly. Not with the specific reluctance of a man making a concession. He nodded the way a doctor nodded when the assessment matched his own and the plan was clear. Get him prepped, he said. She turned back to the bay. What followed was 40 minutes of the specific work that existed in the space between the decision and the operating room. Stabilization, consent, the delicate management of a patient who understood exactly what was happening to him and was choosing to remain functional and present about it instead of surrendering to what his body was signaling. Pruitt was, she found, a precise and unsentimental patient. He asked specific questions and listened to the complete answers without interrupting. When the anesthesiologist explained the risks, he said, "Understood," and signed the consent without drama. When they started the IV line and the medication drip that would keep his pressure in the survivable range until the OR was ready, he lay back and looked at the ceiling with the expression of a man taking inventory. Then he looked at her. "You know what's happening to me," he said. It wasn't a question. "Yes." "Dr. Holt is good." "Yes," she said. "But you're the one who saw it on the films." She adjusted his IV line. "Dr. Holt and I both—" "I'm not asking you to be modest," he said. "I'm telling you what Driscoll told me, which is what he told me 40 minutes ago when he called ahead." He paused. "Sit down for a second." She looked at him. "Please," he said. And the please from a man like this was a more significant thing than the word usually carried. She sat on the edge of the stool beside his gurney. "I don't know you personally," he said, "but I know someone who does, and that person called in a significant favor to make sure you were in this hospital tonight." "Who?" He looked at her steadily. "That's not my information to give. But I will tell you this. The person who called said you are exactly the kind of person who gets pushed to the corner of rooms and stays there because it's easier than explaining herself. And that the corner is where she stays until something happens that she can't let happen." She kept her expression even. "And that when that moment comes," Pruitt continued, "she handles it so well that the people who put her in the corner don't know whether to apologize or be grateful." "Whoever told you that is oversimplifying," she said. "Probably." He almost smiled. "But they're not wrong, are they?" She stood up, checked his pressure. The number was holding. "You're going to be fine," she said. "The procedure is straightforward for someone with Dr. Kimani's experience. The endoleak is significant, but it's accessible." "I'm not worried about the procedure," he said. "Then what are you worried about?" He looked at the ceiling again. "I'm worried that after tonight, you're going to go back to the corner and nobody's going to do anything about it." She didn't answer because there was something true in it that she hadn't let herself sit with directly, and this wasn't the moment to sit with it. "Let's get you to the OR," she said. The surgery took 2 hours and 40 minutes. Nora was not in the OR. She didn't have the surgical scope clearance that would have put her at the table, and there was no medical necessity she could have used to justify being there. She was in the department, finishing her shift on the general floor, doing the work she'd been assigned to do, and she did it with the same focused attention she'd given everything for 2 weeks. But she was aware of the OR in the way you were aware of weather, not watching it directly, but calibrated to it. Jacinda found her at the nurse's station at 1 in the morning. "He's out," Jacinda said. "Pruitt, procedure went clean. Dr. Kimani repaired the endoleak. Pressure is stable. He's in recovery." Nora let out a breath she'd been managing carefully for 2.5 hours. "Good." Jacinda sat on the edge of the counter. She did it with the energy of someone who had been holding something and had decided to put it down. "Okay," she said. "I need you to explain some things." "What things?" "The general asked for you by name. Driscoll, the lieutenant colonel, he's been in the waiting area for the last 3 hours. He keeps asking the desk for updates and specifically asking if Nurse Voss is still on shift." She paused. "Holt came out of the OR at the 2-hour mark for a coffee, which he never does, and he stood at the window for 8 minutes looking like someone who'd just found out a test he'd graded was wrong." Nora said nothing. "And Bartlett," Jacinda continued, "told me 20 minutes ago that she heard from one of the OR nurses that Dr. Kimani said the diagnosis on the imaging review was, and the word she used was remarkable, for the speed and the specificity." She paused. "Bartlett said it like she was reporting bad news." "Bartlett has her opinions," Nora said. "Nora." Jacinda's voice changed, quieter, more direct, the voice that didn't pretend. "I've been a nurse for 6 years. I've worked with good nurses and mediocre nurses and 2 or 3 that I've seen do things that surprised me. But the kind of thing that happened today, twice, in 1 shift, that's not experience from Pelham Coast Regional or even a good nursing program." She stopped. "Where did you actually come from?" Nora looked at her hands on the keyboard. "I came from somewhere that taught me to pay attention," she said, "and to keep paying attention even when people tell you to stop." That's not an answer. I know. Jacinda was quiet for a moment. Is someone going to explain it? Eventually? Maybe, Nora said. Not tonight. She meant it as a closing. Jacinda heard it as one, and she slid off the counter and picked up her chartboard. For what it's worth, she said, Corporal Brower woke up from recovery and asked the nurse to find the blonde nurse who was there when he came in. He wanted to say thank you. She paused at the edge of the station. She told him they'd pass it along. Nora looked at her screen. Thank you, she said. Jacinda left. At 2:15, she was finishing her final documentation of the shift when dress call appeared at the end of the hallway. He'd changed his jacket at some point, or maybe he'd just taken it off and put it back on. The walk he made down the corridor toward her had the quality of a man who had been sitting still for a long time and had made a decision about something. He stopped at the nurse's station. He's stable, she said, before he could ask. I know. I spoke with Dr. Kimani. He leaned against the counter with his arms crossed in the way of someone taking a calculated rest. I owe you an explanation. You don't, she said. I have one anyway. He looked at the end of the hallway, the way people looked at middle distances when they were working out the right way into something. General Pruitt was being transported to this hospital specifically, not because it was the nearest facility, because someone made a call this afternoon that put Hargrove Bay and Callaway Defense Medical Center into the transport plan. She kept typing. Someone. Brigadier General Mara Osei, dress call said. Retired. She called the installation medical office 4 hours ago and identified this hospital as the preferred transport destination for General Pruitt, given his history and the suspected presentation. The typing stopped. Mara Osei. She hadn't heard that name in 2 years. She hadn't said it in longer. She also, Driscoll continued, his voice careful and measured, provided your name, your current placement at this facility, and your... He paused in the way of a man choosing exact words. Your relevant background. Nora looked at the station counter. There was a small scratch in the laminate surface, old and worn smooth, probably from years of chartboards and coffee mugs. Osei doesn't know I'm here, she said. I didn't tell her. She found out, Driscoll said simply. She tends to. I haven't had contact with anyone from... She stopped. From that part of your life, he said, filling in the space where she'd stopped without specifying what the space contained. She knows that too. She said to tell you, specifically, that she's not trying to pull you back anywhere. She just needed someone at the end of this flight who would understand what they were looking at. Nora was quiet. Outside the window, the helipad lights had gone to their standby configuration. The low amber glow that meant the pad was clear and the emergency was over. Osei's well? She asked, and she said it like someone asking about weather when they meant something with more weather in it. She's good, Driscoll said. She asks about you. Not through official channels. Just as a person asking about another person. Nora nodded. She turned back to her screen. The documentation was almost complete. The shift would end in 45 minutes, and then she would drive home in the dark to the apartment she'd rented month to month on the north side of Hargrove Bay. And she would make coffee and sit at the kitchen table and look at the water, which was what she did on the bad nights and the complicated nights and the nights that were neither but that needed processing anyway. There's one more thing, Driscoll said. She looked up. Holt filed the incident report on you this afternoon, he said, before the transport arrived. I know that because the administrative officer at this installation is required to flag any formal complaints involving staff who interact with military patients for coordination purposes. He paused. The report is in the system. It names you specifically for, it says, unauthorized clinical interference and insubordination during a trauma procedure. She looked at him steadily. I know, she said. It will go to the hospital board. I know that too. Nora. He said her name with the particular weight of someone who didn't use first names lightly. You saved Corporal Brower's life this afternoon. Then you identified a life-threatening complication in a general officer that the attending hadn't caught yet. And there is a formal document in the hospital system describing you as a problem. Yes, she said. That bothers you. Yes, she said again. But being bothered doesn't change what it is. I'll respond through the process. I'll cooperate with the review. If the board meets on Friday, he said. She looked at him. That's fast. Holt requested expedited review. He wants a ruling before the end of the week. Driscoll's expression was the expression of someone delivering information that came with implications he found professionally irritating. He was apparently concerned you'd have more opportunities to... He stopped, selected different words. He described it as preventing further disruption to department culture. Nora looked back at her screen. She thought about Pruitt, in recovery right now with stable pressure and a repaired graft, alive because a 12-month follow-up had been missed, and a transfer nurse had read a film at the right moment. She thought about Brower in surgical recovery asking for the blonde nurse. She thought about Osei, wherever she was right now, who had made a phone call from a life Nora had walked away from to put her in the right room at the right moment, and hadn't asked for anything in return except for Nora to be who she was. She thought about Friday. "Thank you for telling me," she said. "What are you going to do?" She saved her documentation. She logged out of the system. She picked up her bag from under the desk. "I'm going to finish my shift," she said. "Then I'm going to go home. Then I'm going to show up on Friday." She started down the hallway. "That's it?" he said. She looked back at him once. "What were you expecting?" He didn't answer immediately. Then, "Honestly, I'm not sure. But General Pruitt said something in the transport before we landed. He said..." He paused. "He said whoever put her in a corner made a mistake, because people like that don't fight their way out. They just wait until the room rearranges itself around them." She held his gaze for a moment. Then she turned and walked to the elevator. The night floor was quiet. Her patients were stable. Her documentation was complete and accurate and would say exactly what had happened in the precise clinical language that left no room for interpretation. She pushed the elevator button. From down the hall, she heard Driscoll's phone ring. She heard him answer it. She heard, in the 2 seconds before the elevator doors opened and swallowed the distance between them, a single sentence in a voice that had gone formal and alert in the way of military voices receiving significant information. "Yes, sir. She's still in the building. Understood." A pause. "I'll tell her." The elevator doors opened. She stepped in. She turned around. Through the narrowing gap of the closing doors, she could see Driscoll walking toward her with his phone still in his hand, and an expression that had shifted completely. Not urgency, not alarm, but something that looked almost like the specific satisfaction of a man watching something he'd suspected come true ahead of schedule. The doors closed. She stood in the elevator as it descended, and she understood with the particular clarity of someone who had spent years reading situations the way other people read text, that whatever Driscoll had just been told was not the end of something. It was the beginning of something she hadn't prepared for, which was the specific kind of things she'd learned, over years in places that didn't appear in personnel files, that you could never fully prepare for anyway. The elevator stopped. The doors opened onto the trauma bay level. And standing in the corridor in full Marine dress uniform at 2:30 in the morning, with the bearing of a man who had not sat down in several hours and was not going to sit down until he'd done what he came to do, was a colonel she had last seen in a place she had never spoken about to anyone in this building. He looked at her. She looked at him. "Voss," he said. "Mercer," she said. And the 2 years she had spent being only a nurse were over. Colonel Mercer hadn't changed in 2 years in the ways that mattered. He was still built like someone who'd made a decision about physical fitness early in life and never revisited it. Still had the scar along his left jaw that traced the path of something she knew the official report had described differently than it happened. Still stood with the particular stillness of a man who had learned that stillness communicated more than movement in most situations. What had changed was the weight behind his eyes. Not heavier exactly, more settled. Like a man who'd been carrying something for a long time and had finally decided where to put it down. "You look like a nurse," he said. "I am a nurse," she said. "Yeah." He glanced at her badge. Voss, N.R.N. Something moved across his face that wasn't quite amusement. "You even changed your first name." "Nora's my middle name." "I know." He looked at the elevator doors behind her, then back. "Walk with me." It wasn't a request, but it wasn't an order either. It was the particular register that existed between people who had a shared history that made standard social categories insufficient. She walked with him. The corridor at 2:30 in the morning had the specific quality of hospital nights everywhere, the hum of the ventilation system, the distant beeping of monitors through closed doors. The odd clarity that came from fluorescent lighting in a building where most of the occupants were asleep or sedated. Their footsteps were the loudest thing in it. Osei told me what she did, Nora said. Osei does what she thinks is right, Mercer said. That hasn't changed. She put me in a difficult position. She put you in the right room. He said it without apology, which was characteristic. There's a distinction. Mercer. Voss. They stopped at the window at the end of the corridor, the one that looked out over the helipad. The pad was dark now, except for the low perimeter lights, the amber glow reflecting off the wet concrete surface. It had rained while Pruitt was in surgery, the kind of light rain that came in off the bay and disappeared before anyone could call it weather. Tell me why you're here, she said. Not why Osei called. Why you specifically are standing in a Virginia hospital at 2:30 in the morning in dress uniform. He looked out the window for a moment. I was in Raleigh for a command review, he said. Pruitt's collapse happened while I was in the building. I was the senior officer present when the field medic made the call to transport. He paused. I flew with him. And the uniform? I was at a formal dinner when it happened. He looked down at himself with the expression of someone who'd forgotten they were wearing something until reminded. Didn't have time to change. She believed him. Mercer did not wear dress uniform for effect. There's a board review on Friday, she said. Hospital board. The chief of trauma filed a formal complaint about my conduct today. 2 incidents, both involving patients who survived because of the conduct he's complaining about, but that's the situation. Mercer turned from the window. I know, he said. How? Dress call, he said. He briefed me in the elevator on the way down. He had the incident report pulled up on his phone. His jaw set in a specific way. Read the whole thing. It's accurate in its facts, she said. It characterizes those facts in a particular way. I'm not going to pretend Holt doesn't have grounds to raise procedural concerns. You stepped in front of a physician to stop him from killing a patient. That's my characterization. His is different. His is wrong. Mercer. She said his name with the particular weight of someone redirecting. I'm not asking for intervention. I'm telling you the situation so you understand the context you've walked into. He was quiet for a moment. Quiet in the way he got when he was deciding something. Not performing deliberation, but actually doing it, which was a thing she'd always respected about him, even when she disagreed with the conclusions. There are things you don't know yet, he said. About tonight? About why Osei made that call. About what's been happening at Stonehaven installation for the last 6 months. He looked at her directly. About why Pruitt collapsing in that briefing room is more complicated than a missed follow-up appointment. She waited. Not tonight, he said. It's late, and there are things I need to confirm before I say more. But I need you to not disappear. I need you to be reachable. I have a Friday board review. I know, be at the board review. He held her gaze. And Voss? Be all the way there. Not the version of you that keeps things in the bag. The real version. She looked at him for a long moment. That version creates problems, she said. That version solves them, he said. Eventually. He straightened, the small, almost imperceptible shift that meant a conversation was ending for him. Get some sleep, he said. I'll be in touch before Friday. He walked back down the corridor toward the administrative wing, and she watched him go, and she thought about what he'd said, about things she didn't know yet, about why Pruitt's collapse was more complicated than it appeared, and she recognized the specific feeling of a situation that had not finished revealing itself. She went to finish her shift. She did not sleep particularly well, which she'd expected. The apartment was quiet, and the view from the kitchen table was the bay, gray and flat in the pre-dawn, and she drank her coffee and looked at it and let her mind do what it needed to do, which was organize itself around the variables she had and acknowledge the ones she didn't. Variable 1. Pruitt was alive and stable, which was the best possible outcome of the medical situation and the one she'd been working toward since the moment she saw Driscoll in the corridor. Variable 2. Holt's incident report was in the system, the board review was Friday, and she had 2 days to prepare a response that was accurate, professional, and not defensive in the way that made defensive-sounding things look worse than they were. Variable 3. Mercer was here. which meant something had pulled him out of whatever Raleigh command review he'd been at with enough urgency that he'd flown with a critically ill general and was standing in a hospital corridor at 2:30 in the morning instead of delegating the follow-through to Driscoll, who was entirely capable of handling the follow-through. And variable 4, the one she sat with longest, looking at the gray water, was Ose. Mara Ose, who had been her commanding officer in the last operational context she was permitted to describe only in the most generalized possible terms, who had signed off on her separation paperwork with the particular expression of someone doing something that was right and felt wrong simultaneously, who had not been in contact for 2 years and had apparently been tracking her placement in civilian healthcare with enough specificity to route a general's medical transport to a specific hospital in Hargrove Bay, Virginia. That was not a casual thing to do. Ose didn't do casual things. She drank her coffee and waited for daylight. Thursday passed in the specific way that days passed when you were waiting for Friday. She worked her shift. She was assigned to general floor again, Holt's doing, confirmed without being stated directly. And she managed her patients with the same attention she gave everything, because the patients didn't know about incident reports or board reviews, and their needs didn't adjust for her situation. Corporal Brower was moved to a recovery room on her floor at 10 in the morning. She checked in on him as part of her standard rounds. He was 26, with the particular look of young Marines in recovery, impatient with their own limitations, inclined to try to demonstrate they were better than the monitors said. His shoulder would heal. The pneumothorax had resolved cleanly. "You were there," he said, when she came in. "When they brought me in. You were at the station." "I was," she said. She checked his drain, clean. "The other nurses said you called it, the thing with my chest." "The attending made the call," she said, which was accurate. He looked at her with the direct, uncomplicated gaze of someone who'd been told something and decided what to do with it. "I know what I heard," he said. "I was conscious enough to hear it." She made a note in his chart. "You're recovering well," she said. "Range of motion exercises start tomorrow. Don't push the shoulder before the PT clears you." "Yes, ma'am," he said, in the way of a Marine addressing someone who'd earned the ma'am regardless of rank structure. She left his room and thought about Mercer saying the real version, and thought about how the real version and the visible version had been the same thing for exactly one shift, and how that had gone. At 3 in the afternoon, she was in the break room with a mediocre cup of coffee and Jacinda, who had brought her own lunch and the specific expression of someone who had thoughts, and had been waiting for an appropriate moment to deploy them. "Bartlett has been telling people," Jacinda said, without preamble. "Telling people what?" "That you manipulated the situation with General Pruitt, that you somehow—" Jacinda made a face that communicated what she thought of this theory. "That you somehow engineered being called to the trauma bay so that you could undermine Holt's authority in front of the military personnel." Nora looked at her coffee. "That's creative," she said. "It's also what Holt apparently told 2 of the attending physicians this morning. Not in those exact words, but in words that pointed in that direction." Jacinda set down her fork. "He's building a narrative, Nora, for Friday." "I know. He has the support of the administrative director. I don't know what was said in that meeting, but the director looked like someone who'd been handed a problem and was deciding how to make it smaller quickly." Nora thought about that. Administrative directors at hospitals like Callaway had competing priorities, and one of those priorities was maintaining productive relationships with the senior physicians whose reputations attracted funding and patients and institutional standing. Holt had 17 years of that capital. She had 2 weeks. The math was not complicated. "What are you going to say on Friday?" Jacinda asked. "The truth," Nora said. "That might not be enough." "It's what I have." Jacinda was quiet for a moment. Then, "Driscoll came back today. He met with the administrative director this morning. I don't know what was said, but her assistant told me it was a 45-minute meeting and that the director looked different coming out than she did going in." Nora set down her coffee. She hadn't known Driscoll was back. She hadn't been told, which meant he was doing something on a track that wasn't coordinated with her, and she didn't know whether that was helpful or its own category of complication. "Different how?" she asked. "Less certain," Jacinda said, like someone who'd just been told the problem was bigger than they'd thought. That night, Mercer called. She was at her kitchen table with the bay outside and a patient chart she'd brought home to review. not because she needed to, but because reviewing charts was something to do with her hands when her head was working on something else. "Board review is still Friday," he said, without greeting. "I know. There are going to be people in that room who weren't there when Holt filed the complaint." She sat up slightly. "What people?" "Driscoll will be there, formally, as a representative of Stonehaven Installations Medical Liaison Office." A pause. "And I'll be there." "Mercer, I have grounds," he said. "I was present during the treatment of a patient under my command. I'm entitled to provide a witness statement to any review board examining care provided to that patient." "You're going to walk into a civilian hospital board review in uniform." "I'm going to walk in as a material witness," he said. "The uniform is incidental. Nothing about a Marine colonel is incidental." "No," he said, "it isn't." She was quiet for a moment. "You said there were things I didn't know, about why Pruitt's collapse was more complicated." A pause on his end, then his pauses usually ran. "Pruitt was at Stonehaven for a specific reason," he said. "There's been an internal review underway for the last 4 months. Irregularities in the medical procurement system for the installation, supply contracts, equipment, medication sourcing. Someone has been systematically overcharging and under-delivering, and the paper trail has been pointing in a direction that involves people at several levels." She waited. "Pruitt was there to receive the preliminary findings," Mercer said. "I was in the building because 2 of the senior officers who initiated the review had asked him personally to be present for the briefing. He's been quietly supporting the investigation for 3 months. And his collapse is almost certainly medical. The endoleak is real. The missed appointment is real. I'm not suggesting otherwise." He paused. "But Pruitt being incapacitated at the exact moment the investigation reaches its preliminary stage is convenient for certain people. And those people are aware that he was transported here. And they know you were involved in his treatment." She absorbed this. "Are you telling me I need to be careful?" she said. "I'm telling you the situation has dimensions you hadn't accounted for," he said. "Yes. Be careful." She looked at the bay, which was dark now, the lights of Hargrove Bay reflecting on the water in broken shapes. "Who initiated the Stonehaven review?" she asked. A beat. "Oh, say," he said. She closed her eyes briefly. "Of course." "She retired," Nora said. "She retired from active duty. She took a civilian contractor role in installation oversight 6 months ago." A pause. "She's been very busy in that role." "Is she safe?" "She's Osei," he said, which was not an answer, and both of them knew it, and neither of them said so. "Get some sleep," he said. "Friday." He ended the call. She sat at the table for a long time, looking at the water, and she thought about the specific way complicated things had a tendency to find her, not because she looked for them, but because the set of things she was capable of doing was exactly the set of things that complicated situations required. And situations had a kind of gravity that way. She thought about Holt's incident report, and about Pruitt recovering in a hospital room 3 miles from here, and about an investigation into military procurement that involved people who found a general's incapacitation convenient, and about a board review that was supposed to be about whether a transfer nurse had exceeded her professional scope. She thought about Mercer saying the real version. She picked up her phone. She found the contact for her licensing board and began composing a careful, precise, complete account of everything she'd observed and done in the past 2 weeks, with the clinical rationale documented for each decision and the timeline exact. She sent it at midnight. Friday arrived with the particular quality of days that had been anticipated long enough to take on weight before they started. She dressed in the clothes she'd chosen the night before, not her scrubs, because this wasn't a clinical shift, and not the civilian equivalent of casual, because this was a board review, and she understood the language of appearance. And she drove to Callaway in the early gray light and sat in the parking lot for exactly 4 minutes. Not because she was nervous, because she was deciding, one final time, what she was going to bring into the room with her. She got out of the truck. The board review was held in the administrative conference room on the 4th floor, a functional space with a long table and chairs, a wall-mounted screen, and the particular atmosphere of rooms where institutional decisions were made, which always had a faint quality of judgment built into the architecture, regardless of how the furniture was arranged. When she entered, she counted the people at the table. 7 board members, including the administrative director, Dr. Vivian Solano, who sat at the center with a folder in front of her and an expression that confirmed what Jacinda had said about her looking different after Driscoll's meeting. Holt, to the left, with two attendings who had apparently been asked to provide supporting statements. He looked like a man who'd prepared for a specific conversation and was experiencing the low-grade alert of a situation that was not entirely matching his preparation. Because on the right side of the table, in the chairs designated for witnesses and affected parties, sat Lieutenant Colonel Aaron Driscoll in his service uniform. Beside him, a woman Nora didn't recognize, early 50s, civilian clothes, with the quality of someone who was very comfortable in administrative rooms and was not here as a favor to anyone. And at the far end of the right side, Colonel Marcus Mercer, USMC, in full service uniform. Holt saw Mercer the moment Nora entered the room. Something changed in his face. Not dramatically, the way a wall changes when a crack appears. The structure is intact, but something has compromised it. She took her seat at the witness table beside Driscoll. "Thank you all for being present," Director Solano said. She had the voice of a woman who had run a lot of difficult meetings and had developed the specific skill of sounding neutral without sounding evasive. "We're here to review a formal complaint filed by Dr. Reardon Holt, Chief of Trauma Surgery, regarding the conduct of Nurse Nora Voss, RN, during two separate incidents on October 28th. The board has reviewed the written documentation submitted by both parties and will hear statements today before deliberating." She looked at both sides. "Dr. Holt, you may begin." Holt had clearly prepared. His statement was organized and specific. He described the Brower incident with clinical detail, framing Nora's intervention as an escalating pattern of insubordination that had begun on her first day. He was careful. He was credible. He used language that made his position sound institutional rather than personal, and several times he referenced protocols and scope of practice frameworks in ways that were accurate enough to land. He spoke for 12 minutes. When he finished, Director Solano looked at Nora. "Nurse Voss?" She had not written a prepared statement. She'd considered it and decided that a prepared statement had a particular quality, the quality of something shaped to persuade rather than to inform, and that this room would hear the difference. She described the Brower incident in the order it happened. She described what she'd observed, the clinical basis for her assessment, what she'd communicated and to whom and in what words. And she described Holt's action, the needle decompression, and the outcome. She did not editorialize. She did not characterize Holt's performance. She described her own conduct and left the characterization to the room. Then she described the Pruitt incident, the films, the endeleak, her conversation with Holt at the imaging screen, and the plan that had come from that conversation. She spoke for 9 minutes. When she finished, one of the board members, a physician she didn't know from the hospital's surgery department, said, "You described the Brower intervention as communicating an observation. Dr. Holt's account indicates you physically repositioned yourself into the clinical space." "I moved closer to the patient to auscultate," she said, "with a stethoscope. The physical proximity was necessary to confirm what I was hearing, without authorization. The authorization was the patient's vital signs." A pause. Holt said from the left side of the table, "That is precisely the problem. Nurses do not self-authorize based on their personal assessment of urgency." "With respect," Driscoll said, and his voice was the voice of a man who had waited as long as he intended to wait. "I'd like to speak to the board regarding the military context of these events." Solano nodded. Driscoll spoke for 7 minutes. He described Pruitt's transport, the request for Nora specifically, the imaging review, and the surgical outcome. He was precise and without visible emotional investment, which was more persuasive than visible investment would have been. Then Mercer spoke. He spoke for 4 minutes. He did not describe Nora's past in specific terms. He did not name operational contexts or classified missions, or anything that would have required the room to have clearances it didn't hold. What he did was describe, in the measured cadence of a man making a formal statement, that Nurse Voss's background included extensive experience in high-pressure medical environments that exceeded standard nursing training in both scope and technical complexity, that her capacity to identify emergent clinical presentations had been demonstrated in conditions significantly more demanding than a trauma bay, and that in his professional assessment, based on direct observation of her work, her conduct during both incidents was not only appropriate but represented the standard of care he would want for any personnel under his command. The room was quiet after he stopped. Holt said, carefully, "The board is reviewing a nurse's conduct within a civilian hospital according to civilian nursing standards. Whatever this officer's background experiences may be, they don't govern the protocols of this institution." "No," Mercer said, "they don't." He looked at Holt directly. "But they do speak to whether the nurse in question had the competence to make the assessments she made, which appears to be what's actually in dispute." Holt's jaw tightened. Director Solano said, "We'll take a brief recess before the board deliberates." The hallway outside the conference room was the kind of institutional space that existed in every large building, utilitarian, fluorescent, the scuffed baseboard of a corridor that had seen a lot of anxious people move through it without caring about them particularly. She stood at the window at the end of it, looking at the parking lot below. Driscoll came to stand beside her. "How are you doing?" he asked. "Honestly?" She considered it. "I don't know. I said what I needed to say. Whether it's sufficient is someone else's decision." Mercer was good in there. Mercer is always good in rooms. She paused. "It doesn't always make a difference." "There's something else," Driscoll said. His voice had shifted into the register he used when information was both important and uncomfortable. She looked at him. "Osei submitted a formal written statement to the board," he said. "Filed it through the installation's medical liaison office last night. I didn't know until this morning." "What's in it?" "A full account of your military service record. Not classified, sir. The parts that can be released under a civilian proceedings request. Commendations, assessments, clinical outcomes from your operational deployments," he paused. "And a formal recommendation that the board not only clear you of the complaint, but consider what it would mean for this institution to have someone with your background in a constrained support role." She absorbed this. "She recommended I be..." "What?" "She recommended the board consider whether the incident report reflects a problem with you," he said carefully, "or a problem with how this hospital has been using you." She was quiet. From inside the conference room, through the closed door, she could hear the muffled movement of people deliberating, the specific texture of voices too low to make out, but too many to mistake for silence. Then Driscoll's phone buzzed. He looked at it. The expression on his face changed in a way that had nothing to do with the board review. "What?" she said. He held the phone so she could see the screen. It was a text from a number she didn't recognize, but the name in the contact field was Osei, Mara. The text read, "Stone Haven. They moved up the timeline. Pruitt needs to know before he's discharged. I can't be the one to tell him. Mercer can't either. It has to come from someone he already trusts in that building." She looked at the text. She looked at Driscoll. "What timeline?" she said. He was already dialing, and from inside the conference room the door opened. Director Solano stood in the frame. "Nurse Voss," she said, "the board is ready." Nora looked at the open door. She looked at Driscoll, who had the phone against his ear and the expression of a man receiving information that was moving faster than he could contain it. He held up one hand, not stopping her but flagging, "This matters. This is happening now. The thing Mercer warned you about is moving." She looked at Director Solano. "Thank you," she said. "I'll be right in." She turned back to Driscoll. "Tell me fast," she said. He lowered the phone. What he said next was 11 words, and each of them landed with the weight of something that had been moving toward this moment for months, and that had just arrived. "They found Osei's name in the procurement files," Driscoll said. "Someone planted it. They're trying to make her the source of the irregularities instead of the person who found them." 11 words had become 20, but the weight was the same. She held it for exactly 2 seconds. Then she walked into the conference room. The board was arranged the way it had been before the recess, except that the quality of the room had shifted in the way rooms shifted after deliberation. Something had been decided, and the people who'd decided it were now managing the gap between the decision and the saying of it. Director Solano had a pen in her hand that she wasn't using. The physician board member who'd questioned her earlier was looking at the table. Holt was looking at her with the specific expression of a man who believed he already knew the outcome and was managing his own reaction to it. She sat down. She did not look at Mercer. She did not look at Driscoll, who had followed her in and taken his seat with the careful neutrality of someone holding something combustible in a room that couldn't handle fire yet. "Nurse Voss," Director Solano said, "the board has completed its initial review and deliberation." She paused in the way of someone organizing language that needed to carry weight accurately. We are not prepared to issue a full ruling today. Holt's expression shifted, fractionally, but she caught it. We require additional time to review materials submitted this morning by the Installation Medical Liaison Office, Solano continued. Specifically, a formal statement and documentation package submitted by a civilian oversight contractor affiliated with Stonehaven Installation. She looked down at her folder. We're extending the review period by 72 hours. During that period, Nurse Voss will remain on administrative assignment, not punitive, not a suspension, a standard procedural hold, while the board completes its review. Director, Holt said. His voice was controlled, but the control had an edge underneath it. The documentation that's been submitted is largely irrelevant to the scope of practice question. Whatever this nurse's background may include, the board is charged with reviewing her conduct within this institution against this institution's protocols. The board is aware of its charge, Dr. Holt, Solano said, and something in her voice had changed since this morning, some quality of deference that was no longer quite there. The statement submitted by the oversight contractor goes beyond the scope of this review. It introduces, the board will determine what falls within scope, Solano said, not unkindly, definitively. Holt looked at her for a moment. Then he looked at Nora. The look had a quality she recognized, the particular calculation of a man who had built an argument on a foundation he'd believed was solid and was now assessing, rapidly and without wanting to, whether the foundation had shifted. 72 hours, Solano said. We'll reconvene Monday morning. Thank you all for your time today. The room moved toward adjournment. She stood, picked up her bag, and was in the corridor before most of the room had finished standing. Mercer caught her at the elevator. He didn't say anything for a moment. He stood beside her and looked at the elevator doors and had the quality of a man choosing between three things to say. Ossie's name is in the procurement files, she said, before he chose. I know, he said. I found out 20 minutes before you did. Driscoll told me in the recess. It's fabricated. Of course it's fabricated. He said it with the flat certainty of someone who had no interest in entertaining the alternative. The question is who put it there and when, and what they expect it to accomplish. It discredits the investigation. It discredits the investigator, he said, which is strategically smarter. The investigation's findings are documented. You can argue methodology and sourcing on documented findings. But if you make the lead investigator the story, if suddenly the person who built the case is the person the case is built around, you create enough noise to stall everything long enough for the people with exposure to manage their exits. The elevator arrived. They stepped in. Pruitt needs to know before he's discharged, she said. Yes. Ossie said it had to come from someone he already trusts in this building. She's right. Pruitt's relationship with his installation command it's complicated right now. The people he trusted professionally are the people potentially compromised by the investigation. If this information comes through official channels, it gets filtered before it reaches him. And if it comes from his attending physician, Mercer looked at her. Kamani isn't briefed on the investigation. Bringing her into it now creates a liability. From a nurse, then, she said. He held her gaze for a moment. You're on administrative hold. Administrative assignment, she corrected. I can be in this building. I can visit a patient. Visiting a patient isn't clinical work. It's human consideration. The elevator stopped on the recovery floor. Nora, he said. Not Voss. The other register. Don't, she said. Don't tell me it's above my scope. You said the real version. This is the real version. He was quiet for a moment. Room 412, he said. He's being prepped for discharge this afternoon. The window is 3 hours. She stepped off the elevator. Well, room 412 had the particular quality of hospital rooms on the day of discharge. The tentative energy of someone who had been stationary long enough that movement felt like a decision that required relearning. Pruitt's personal aide, a young corporal who looked like he'd been awake for 36 hours, was folding items into a kit bag with the careful diligence of someone doing a task they needed to get right. Pruitt himself was in the chair by the window, dressed in his service uniform, which someone had brought him. He looked better than he had on the gurney. The color had come back, the gray beneath his skin replaced by something that looked like recovery rather than its absence. He still moved carefully. The repair was stable, but the body was still accounting for everything it had been through. He looked up when she came in. Nurse Voss, he said. General? She nodded at the aide. Could we have a few minutes? Pruitt looked at the aide. Hendricks, take 15. The corporal picked up the kit bag and left with the quiet efficiency of someone who had been doing this long enough not to ask questions. She closed the door. She sat in the chair across from him, not standing, which would have been clinical, but sitting, which was something else. You're not here as my nurse, he said. No. Then as what? As someone who has information you need before you leave this building, she said, and very little time to give it to you. He looked at her with the particular attention of a man who had spent decades making assessments quickly. Tell me, she told him. She told him about Osei's text-to-dress call, about the procurement files, about the planted evidence that put Osei's name in the record as a source of irregularities instead of the person who'd identified them. She told him in the ordered, clinical way she told people things that were complicated and urgent, one fact, then the next, then the implication, and only then the conclusion, so that the person hearing it could track the reasoning rather than just receiving the landing. Pruitt did not interrupt. He sat in the chair by the window and listened with his hands folded on his knees, and his face did the thing that practiced faces did, absorbed without broadcasting, processed without showing the processing. But his jaw tightened when she got to the part about the files, and his eyes went still in the specific way of eyes that had just understood something they wished they hadn't. When was it planted? He asked when she finished. We don't know yet. After I collapsed or before? She held his gaze. Driscoll thinks before, based on the timestamp window that Osei's contractor team identified this morning. He was quiet. So it was already in place, he said. Before the briefing. Yes. They knew the briefing was happening. It appears so. He looked out the window. The view from 412 was the hospital's east courtyard, a functional square of pavement and a few hardy trees that hadn't finished dropping their leaves. The kind of view that wasn't scenic but was real, which was its own kind of quality. Osei, he said. Is she… I don't know her current status, Nora said honestly. Mercer says she's Osei, which is his way of saying she's managing. Something that might have been the beginning of a very tired smile moved across Pruitt's face. That's what everyone says about Osei. She's Osei, right up until the point where being Osei isn't enough. She initiated this investigation at significant personal risk, Nora said. She needs someone with authority over the investigation to formally protect her status before the planted evidence becomes the story. That's me, Pruitt said. That's you. He unfolded his hands. He looked at them for a moment. The hands of a man in his 60s who had made a lot of decisions and was preparing to make another one. Who else knows about the planted files? Driscoll, Mercer, me, Osei, whoever put them there. The board of this hospital? No. The Osei statement they received this morning is from her contractor role in installation oversight. It covers my service record, nothing about the investigation. He nodded, absorbing, organizing. I need to make a call, he said. Before I'm discharged, I need 15 minutes and a secure line. Driscoll has a secure device. Get him. She stood. Nurse Voss, he said. She looked back. The board review, he said. How did it go? They extended the review period, 72 hours. Holt? Present. Prepared. Still filing. Pruitt looked at her with an expression that was several things at once. The assessment of a man who understood systemic unfairness in organizations well enough to have opinions about it, and the particular frustration of someone who could see what was happening and was calibrating how much he was able to do about it. I'll be making more than one call in the next 15 minutes, he said. That's not why I told you, she said. I know. He met her eyes. That's why it matters. She went to find Driscoll. The next 4 hours were the kind of hours that looked quiet from the outside and were anything but. Pruitt made his calls. She didn't know specifically to whom, because she wasn't in the room. She waited in the corridor with the specific patience she'd developed for situations where her part was done and the next part belonged to someone else. Driscoll was inside. Mercer was somewhere in the building, handling something he hadn't described specifically. She sat in a corridor chair and thought about Osei. Mara Osei, who had gone from active duty to civilian contractor in the specific way of people who found they could accomplish more without a uniform, and who had spent 6 months inside the procurement system at Stonehaven, building the kind of evidentiary record that didn't leave room for interpretation. who had tracked Nora's civilian placement and engineered a transport route and made a phone call from a retirement that wasn't really retirement to put the right person in the right room, who now had her name in a file that was trying to make her the story. The corridor was quiet. At 3:40, Driscoll came out of room 412. He walked to where she was sitting and sat in the adjacent chair, which was the posture of a man who needed a moment before he could deliver what he was carrying. Pruitt reached the Judge Advocate General's office, he said, and the Inspector General for USMC Installation Commands. A pause. He also reached the Commanding General at Stonehaven directly. She waited. The procurement files have been placed under a formal evidence hold, Driscoll said, including the section with Osei's name in it. It can't be modified or removed now without triggering a federal tampering charge. She let out a breath. The IG's office is opening a formal inquiry into the planted evidence, he said. That inquiry is separate from Osei's investigation. It runs parallel. They each have their own protective designation now. So the people who planted the files can't use them anymore. They can't use them, and now they have 2 investigations instead of 1, he said, and the second one is specifically about them. She looked at the floor for a moment. The linoleum had a pattern that someone had chosen at some point with the idea that it would be calming, neutral colors, no strong lines. And it was completely ineffective at being calming, but the intention was legible. Osei? She asked. Formally notified. Her contractor status is under IG protection pending the inquiry. He paused. She texted me 20 minutes ago. 2 words. What did she say? About time. She laughed. Not a large laugh, not a performed one. The specific laugh that came from a particular combination of relief and recognition that landed in a particular part of your chest. It was the first time she'd laughed in 4 days. The thing about systemic failures was that they rarely collapsed all at once. What happened instead was a series of smaller collapses, each one following from the last, in the particular cascade of an institutional structure that had been load-bearing on something rotten. Over the next 36 hours, spanning Saturday and the beginning of Sunday, that cascade began. The first thing was the IG inquiry notification reaching Stonehaven Installations command structure, which meant that the senior officers with procurement exposure were no longer operating in the assumption that the investigation could be buried by discrediting its author. They were now operating in the knowledge that there were 2 investigations, and that the second one was specifically about what they'd done to the first one. The second thing was that 3 of those officers, independently and without apparent coordination, requested meetings with legal counsel. This was the kind of thing that was observable from the outside if you knew where to look, and Mercer knew where to look. He told her about it Sunday morning, in the hospital cafeteria, over coffee that was marginally better than the break room variety. The ones who engaged counsel are the ones who know their exposure, he said. The ones who don't engage counsel yet are either genuinely uninvolved or haven't understood the math yet. Which category is the person who planted the files? He looked at his coffee. The IG team has a working theory. They're not sharing it with me, conflict of interest, given my proximity to Pruitt, but based on the timeline Osei's team identified, the access required, and the procurement records she'd built. There are maybe 4 people who had the combination of motive and clearance. Will Osei's investigation survive? It's already survived, he said. The evidence hold means the record is locked. Her findings are documented. The only question now is how long the IG inquiry takes, and whether the people with exposure cooperate or make it expensive. She drank her coffee. And Holt, she said, because they hadn't gotten there yet, and it needed getting to. Mercer looked at her. What about Holt? He's separate from all of this. His incident report is about me, not about Stonehaven. The board review is Monday. I know. The extended review was because of Osei's statement about my service record, she said. That's legitimate grounds for the board to reconsider the scope question. But it doesn't address what Holt is actually complaining about, which is that I exceeded my authority in his trauma bay. You saved 2 patients. That's an outcome, not a protocol. She said it carefully, because it was true. Holt is wrong about what matters and right about what happened. I did step outside the lines he'd drawn. I'd do it again. But the board doesn't have to see those as compatible positions. Mercer was quiet. There's something else, he said. She waited. When Driscoll pulled Holt's incident report, the formal one, filed before the transport, He requested the full documentation package, which includes the supporting documentation Holt attached. He paused. There were attachments that weren't in what was presented to the board. She set down her coffee. What kind of attachments? Complaints, Mercer said. From 2 nurses, filed 6 months ago and 3 months ago, against Holt for conduct in the trauma bay. Specifically, for dismissing clinical observations from nursing staff in ways that contributed to patient complications. Neither complaint was formally investigated. Both were marked resolved at the departmental level. She looked at him. He buried them, she said. He managed them, Mercer said. There's a distinction in what the paperwork says, even if what actually happened was the same thing. Those nurses, Bartlett was the department-level reviewer on both complaints, he said. She signed the resolution paperwork. The cafeteria was doing its Sunday morning business around them. The particular rhythm of a hospital weekend, staff coming and going with the focused tiredness of people working shifts that didn't align with the rest of the world's schedule. She thought about the 2 complaints sitting in a file, marked resolved, which meant invisible, which meant that the pattern of what Holt did to the people who observed things he didn't want observed had been happening long enough to have a documented history that nobody had looked at yet. The board doesn't have those, she said. Not yet. Driscoll is deciding, Mercer said, whether to submit them as supplementary material before Monday's reconvening. He can do that through the Installation Liaison Office. They have standing to submit documentation relevant to patient care standards at facilities that treat military personnel. He should, she said. I agree. He looked at her. But it's his call, and it makes the Monday session something different from what Holt prepared for. She thought about Holt in the boardroom on Friday, prepared and credible, and building a case on a foundation he believed was solid. She thought about the 2 nurses who had filed complaints and been told they were resolved, who had presumably absorbed that resolution and continued working beside him. She thought about what it cost to file a complaint and have it disappear. Who were the nurses? She asked. Mercer looked at her for a moment. One transferred out 3 months ago. The other is still here. She thought about everyone in the department, the ones who watched her, the ones who'd already decided, the ones who'd said things in break rooms that were louder than they thought. Prescott, she said. He didn't confirm or deny, but something in the set of his jaw told her she was right. Prescott, who had been professionally neutral in the 2 weeks she'd been at Callaway, who had neither been hostile nor warm, who had the particular quality of someone who had been disappointed by this institution and had restructured their engagement with it accordingly. I need to talk to her before Monday, Nora said. That's not to influence her testimony, to make sure she knows she has standing to speak. She met his eyes. If Driscoll submits those complaints, Prescott becomes material to the review. She should know that before she walks in cold. Mercer looked at her for a long moment. One conversation, he said. Careful. Always, she said. She picked up her coffee, which had gone lukewarm while they talked. She found Prescott near the end of the Sunday afternoon shift, in the supply room off the main floor corridor, doing the kind of end-of-shift inventory that was technically someone else's job, but that Prescott apparently did anyway, which told her something about what Prescott thought of institutional reliability. Prescott was 41, had been at Callaway for 4 years, and had the specific quality of someone who had adjusted their expectations of their workplace without adjusting their expectations of their own work. She looked up when Nora came in. Voss, she said. Neutral. The neutrality of a woman with a practiced surface. You're doing the linen count, Nora said. That's Hendry's job. Hendry doesn't finish it until it's wrong, Prescott said. And then it's a problem for whoever's here next. Right. Nora stood at the other end of the shelf, not crowding the space. I'm going to say something direct, and I need you to tell me if I'm wrong about any of it. Prescott's hand stilled on the linen stack. You filed a complaint against Holt, Nora said. 6 months ago. It was marked resolved at the departmental level. Bartlett reviewed it. A pause. Prescott's expression didn't change exactly, but the surface shifted. The particular shift of someone confronted with a thing they'd put away and not expected to see again. How do you know that? She said. Military Liaison Office pulled the full documentation package for the board review. The complaints were attached to Holt's filing against me, which means they're now part of the formal record. Prescott looked at the linen stack. It was resolved, she said, flatly, not arguing, stating the official version. It was suppressed, Nora said, with the same flatness. Bartlett signed off on a departmental resolution without a formal investigation. The patient complication you reported isn't in any flagged record. Prescott's jaw tightened. What do you want from me? Nothing, Nora said. I want you to know that the complaint exists in the formal record now, that it's been submitted to the board as supplementary material, that if the board chooses to examine it, you have standing to speak to what you observed and what happened afterward. I don't... Prescott stopped. Started again. I filed that complaint and it cost me something. The way people treated me for a month after, the assignments I got, the way Holt looked at me every morning when he came through. She looked at Nora directly. It wasn't worth it. I know, Nora said, and you want me to do it again. I want you to know that this time the room is different, Nora said. The board has material that wasn't there before. Military liaison is engaged. There's a record now that can't be made invisible the way yours was. She paused. What you do with that is yours. Prescott looked at her for a long moment. You're on administrative hold, she said. Administrative assignment, Nora said. You're here on a Sunday talking to me about my complaint. Prescott's voice had lost some of its managed flatness. Underneath it was something older and more complicated. The specific exhaustion of a person who had tried the right thing once and paid for it and hadn't decided yet whether there was such a thing as the right time to try it again. Why? Because you were right, Nora said, about what you observed and about what should have happened afterward. And being right about it mattered, even if nobody told you it did. Prescott looked at the linen stack. Then she picked up her clipboard. Mondays at 9, she said. 8:30, Nora said. I start at 7. Prescott made a notation on her inventory sheet. I'll be available. Nora left the supply room. But Monday morning arrived the way consequential mornings arrived. Not dramatically, but with a quality of accumulated pressure that had been building since Friday and was now present in the ordinary texture of the day. The parking lot, the automatic doors, the fluorescent lights of the lobby. The coffee she got from the machine near the administrative wing, because the break room felt complicated this morning. She was in the 4th floor corridor at 8:25 when dress call found her. The board has the supplementary materials, he said. I submitted them at 7 this morning. Holt was notified at 7:45. How did he respond? He's been in his office since 8. Driscoll paused. His administrative assistant says he hasn't come out. She absorbed this. Holt in his office at 8 in the morning, alone, with documentation he hadn't known existed now in the board's hands. She thought about the 2 complaints marked resolved, about Prescott doing someone else's inventory on Sunday afternoon, about the specific way institutional protection worked until the day it didn't. One more thing, Driscoll said. He held out his phone. On the screen was an email sent at 6:47 that morning from a Stonehaven installation address she didn't recognize. The subject line was Procurement Inquiry, Voluntary Cooperation. One of the 4 people on the IG's working list, Driscoll said, sent a cooperation request this morning, before business hours. He paused. They're talking. She looked at the email. The cascade was moving. She handed the phone back. At 8:50, she walked into the conference room. The board was assembled. Solano was at the center. The physician board member from Friday was present, along with 4 others. Driscoll was at the witness table. Mercer was at the end. Holt walked in 2 minutes after she did. He looked different from Friday. The quality of a man who had spent 72 hours in the assumption of a particular outcome and had arrived this morning to discover that assumption had been weight-bearing on something that was no longer there. He sat down. He looked at the board, at Driscoll, at Mercer. Then he looked at her. And she understood, in the specific way she understood most things that had been moving toward a moment for a long time, that the look on his face was not what she'd expected. It was not the look of a man who had been caught. It was the look of a man who had understood very recently that he had made a category error, that the thing he'd been fighting was not insubordination or ego or a transfer nurse who didn't know her place, that it was something he didn't have a framework for because the framework would have required him to believe, before all the evidence made it unavoidable, that the person in the corner of his trauma bay was not who he'd decided she was. Director Solano said, "The board will come to order." She picked up her pen. She waited. And across the table, Holt folded his hands on the surface in front of him, looked at the documentation he'd been handed when he walked in, Osei's statement, the two suppressed complaints, the formal witness testimony from Driscoll and Mercer, and said nothing, because there was nothing left that the saying of could fix. The board member to Solano's left leaned forward. Before we proceed, he said, the board needs to address a matter that has emerged since Friday's session. He looked at Holt directly. Dr. Holt, the board has received documentation indicating that two formal nursing complaints filed against you in the past 6 months were resolved at the departmental level without the standard investigative review those complaints were entitled to. Can you speak to that process? Holt's jaw moved. He looked at the documentation in front of him. He looked at the board member. And the conference room held its breath in the particular way rooms held their breath, when something that had been going one direction for a long time was about to go another, and everyone in the room could feel the pivot happening even before the words arrived to confirm it. I'd like to request a recess, Holt said, to consult with the hospital's legal counsel. Director Solano looked at him for a long moment. Granted, she said. 30 minutes. The room began to move. Nora stayed in her seat. Driscoll, passing behind her, said quietly, Room 412 is empty. Pruitt was discharged yesterday. She already knew. There's something in it, though, he said. On the bed. He left it before he went. She looked at him. An envelope, he said, with your name on it. Handwritten. She didn't move immediately. She sat for a moment in the clearing room with the sound of chairs and voices and the particular texture of an institution in the process of reckoning with itself. And she thought about a general who had looked at her from a gurney with the recognition of someone who needed exactly who she was, and about a letter she hadn't read yet, and about what it might contain. The 30-minute recess was running. She picked up her bag and walked toward the elevator. The elevator took her to the 4th-floor recovery wing, which was quieter on Monday morning than it had been on the weekend. Fewer visitors, fewer of the particular ambient noise of family members managing their helplessness in hospital corridors. Room 412 was at the end of the hall, door open, the bed stripped and remade with the efficient anonymity that hospital rooms return to between occupants. On the bed, centered on the pillow with the precision of someone who'd placed it carefully and not just left it, was a plain white envelope. Her name on the front in handwriting that was deliberate and slightly cramped, the handwriting of a man who had written thousands of official documents and had developed the particular style of someone who thought faster than their hand moved. She picked it up. She sat in the chair by the window, the same chair Pruitt had been in 2 days ago, and opened it. The letter was 2 pages, handwritten on what appeared to be hospital notepad paper folded in thirds. She recognized the deliberateness of that too. Not official stationery, not a formal document, because he hadn't wanted this to be official. He'd wanted it to be what it was, one person writing to another person. She read it. He wrote the way she would have expected him to write, directly, without decorative language, but with the particular precision of a man who understood that words carried more than their dictionary weight. He thanked her, which took half a sentence. He described what had happened since she'd come to his room Sunday, which took 3 lines. The calls made, the formal protections initiated, the IG inquiry opened. He wrote that Osei's status was formally protected and that the IG had confirmed the planted evidence originated from a specific office within Stonehaven's procurement chain and that a name had emerged from the cooperation request that Driscoll had shown her in the corridor. Then the letter changed quality. The last half of the second page was something different, not operational, not logistical. It was the part a man wrote when he had been very close to dying and had survived and was trying to say something that mattered before the institutional gravity of his role pulled him back into the shape it required. He wrote that he had been in the military for 38 years, and that in those 38 years he had seen people with extraordinary capability spend their entire careers being managed down to a size that was more comfortable for the people around them. He wrote that he had sometimes been the person doing the managing, and that he was aware of this fact and was not proud of it. He wrote that he didn't know what she was going to do with the rest of her career and that it wasn't his business to tell her. But he wrote that there was a difference between choosing a quiet life and being put in one, and that he hoped she knew the difference, and that, if she hadn't been sure before, he hoped the last week had made it clearer. He wrote, "The people who underestimated you were not stupid. They were just working from incomplete information. and they had no interest in completing it. That's a different kind of failure than stupidity. It's harder to fix, and it does more damage. He wrote, "You don't owe anyone an explanation for what you know, but the world is better when you use it." At the bottom, he had written his direct contact information, not a formal address, a personal phone number, and below that a single line. "If you ever need the room rearranged, call me." She folded the letter. She sat in the chair where he'd sat, looking at the empty bay outside, and she let herself feel what the last 9 days had been. Not perform feeling it, actually sit with it. The accumulated weight of the 2 weeks before that, and the particular kind of exhaustion that came from being systematically dismissed by people who had the institutional authority to make that dismissal consequential, and the specific quality of holding yourself together across that duration. She let herself feel all of it. Then she put the letter in her bag, stood up, and went back downstairs. The 30-minute recess had become 45 by the time she returned to the fourth-floor administrative wing. Through the conference room's narrow window panel, she could see the board members in quiet conversation among themselves, and Holt's seat was empty, which meant he was still with legal counsel or had not come back yet. Driscoll was in the corridor, leaning against the wall with his phone, doing the specific thing of looking at his phone without actually engaging with what was on it, the posture of someone waiting. Holt's counsel asked for a second recess, he said, when she came around the corner. The board denied it. They gave him until 9:40. It was 9:37. "What's happening?" she said. Holt's counsel apparently reviewed the supplementary materials during the first recess and advised him that contesting the nursing complaints was going to be counterproductive. Driscoll chose the last word carefully. Given that Prescott confirmed in a written statement submitted this morning that her complaint was not investigated despite the resolution paperwork. She looked at him. "She did it this morning," Driscoll said. "Before 8. She came to the administrative office and gave a written statement voluntarily. Nobody asked her to. She just came in." Nora was quiet for a moment. "Did she say why?" "She said..." Driscoll looked at the floor briefly, then back up. "She said because last time it disappeared, and this time it shouldn't." The conference room door opened. Director Solano stood in the frame. "We're resuming," she said. Holt came in at 9:41, 1 minute past the deadline, which was either a statement or simply the minute it took to get from wherever he'd been to the fourth-floor conference room. His legal counsel, a woman in her 50s with the composed precision of someone who had done this specific thing many times, sat to his left. He looked like a man who had made a decision that cost him something and was in the process of determining how to carry the cost. Director Solano called the session to order. The legal counsel said, "Before the board proceeds, Dr. Holt would like to make a statement withdrawing the formal complaint against Nurse Voss, effective immediately." The room absorbed this. Nora kept her expression neutral, which took effort of a specific kind. Not the effort of suppressing emotion, but the effort of not letting the relief show before the process completed, because the process needed to complete, and she needed to be present for it rather than ahead of it. "The board acknowledges the withdrawal," Solano said. She looked at Holt directly. "However, the board intends to continue its examination of the supplementary materials submitted by the Installation Medical Liaison Office. The withdrawal of the complaint against Nurse Voss does not conclude the board's review of the practices documented in those materials." Holt's counsel said, "We understand." "Dr. Holt." Solano's voice had the quality it had taken on Friday afternoon, not unkind, but with a precision underneath it that had found its footing. "The board has reviewed 2 formal nursing complaints filed within your department in the past 6 months. Both were resolved at the departmental level without the standard investigative process. Those complaints are entitled to under hospital protocol. The resolution documentation bears your authorization and Dr. Bartlett's signature." She paused. "Can you explain the process by which these complaints were resolved?" Holt looked at the documentation in front of him. His counsel put a hand on his arm, the brief practice touch that meant, "I've told you what to say it." "The complaints were reviewed at the departmental level," Holt said. "In my assessment at the time, they did not meet the threshold for formal escalation." "The hospital protocol does not give the department chief discretionary authority to determine that threshold," the physician board member said. "All formal nursing complaints are entitled to escalation to the Quality Review Committee regardless of departmental assessment." "I understand that now," Holt said. The careful phrasing of "I understand that now" landed in the room with the weight of a concession that had been extracted rather than given, which was its own kind of statement. The board will be issuing a formal finding regarding the handling of those complaints, Solano said. That finding will include recommendations for remediation, and it will be entered into the departmental record. She paused. Additionally, the board is placing Dr. Holt's clinical supervision responsibilities under administrative review pending completion of the Quality Committee's examination of the cases referenced in the complaints. Holt said nothing. His counsel said nothing. The room said nothing for 3 full seconds, which in a conference room felt like longer. "Nurse Voss," Solano said, and she looked at Nora with the particular directness of a woman who had arrived at a Monday morning prepared for one meeting and had spent the weekend and the preceding 30 minutes arriving at a different one. "The board finds no grounds to sustain the complaint filed against you. Your conduct in both incidents on October 28th was reviewed against the clinical record, the witness testimony provided, and the professional background documentation submitted by the Installation Medical Liaison Office." She paused. "The board finds that your actions in both cases were clinically appropriate given the circumstances, and that the characterization of those actions as insubordination is not supported by the evidence." She continued, "The board will be recommending a review of how the department's protocols address high-acuity decision-making by nursing staff in emergent situations. We believe the current protocols are insufficiently clear in a way that created the conditions for this dispute, and that clarification serves the department's patients." Nora said, "Thank you." 2 words. The only words she had for the moment, and the right ones, because the moment didn't need more. The hallway afterward had the particular quality of space that had just held something significant and was returning to its ordinary function. Driscoll shook her hand, formally, which was his register, and said that Pruitt had been notified of the board's finding and had sent a 1-sentence response that Driscoll read to her from his phone. "Good. Now do something with it." She laughed. The same laugh as Sunday morning in the cafeteria, specific and genuine and landing in the right part of her chest. Mercer was waiting near the elevator. He didn't shake her hand. He stood with his hands in his pockets and looked at her with the expression of someone who had expected this outcome and was allowing himself to be satisfied by it anyway. "Stonehaven," she said. "The IG inquiry." "Moving," he said. The cooperation request came with names. The person who planted the files in Osei's name was a procurement officer named Grabel, deputy director, 3 years in the role, access to the exact systems the planting required. He paused. He also had exposure in the original irregularities. He was trying to solve 2 problems at once. Is he talking? He's talked. Past tense. The IG accepted his cooperation agreement this morning. The inquiry is now a formal investigation, which means it has subpoena authority and a timeline. He looked at her. Osei's investigation stands. Her findings are the foundation of the formal case. She'll want to see it through herself, Nora said. She already is. She was on a call with the IG's office at 7 this morning. I heard secondhand that she was characteristically the most prepared person on the call. Of course she was. Nora looked at the elevator doors. What happens to Holt? She asked. Mercer considered it. The board's administrative review determines the scope of his supervision restrictions. If the Quality Committee finds that the suppressed complaints involved patient harm, which the evidence suggests, it goes to the state licensing board. That takes time. It does. And the outcome isn't guaranteed, but the record exists now. He held her gaze. The record existing is the thing. Everything else follows from that. She thought about Prescott, who had come in before 8 this morning and put the record in writing for the second time, knowing the first time had cost her something and doing it again. That was not a small thing. It was maybe the largest thing that had happened in the last 72 hours, measured not by its institutional consequence, but by what it took from a person to do it. I want to talk to Prescott, she said. You should, Mercer said. She started toward the stairwell. The elevator felt too slow for the particular energy of this moment. Voss? Mercer said. She turned. He had the expression of a man arriving at the last thing, which for Mercer always arrived with more weight than most people's last things. You said the real version creates problems, he said. I want to correct something. What the real version actually does is clarify them. The problems were already there. You just stopped being the reason they stayed invisible. She looked at him for a long moment. Then she pushed through the stairwell door. She found Prescott at the MedSurg nurses' station, starting her shift with the specific focus of someone who had done a significant thing that morning and was now managing the ordinary work with whatever was left of themselves. She looked up when Nora came around the corner. "Board ruled," Nora said. Prescott set down her chart. "I heard." "Your statement was part of why," Nora said. "I want you to know that directly, not through a corridor." Prescott looked at her with the complicated expression of someone receiving something they'd decided they didn't need and finding they'd been wrong about that decision. "It shouldn't have taken 2 tries, Prescott said. "No, it shouldn't have. And it shouldn't have taken someone else in trouble to make the second try feel worth it." "Also true," Nora said, and she said it without deflecting because Prescott was right, and she deserved to be right without being managed into a more comfortable version of it. Prescott was quiet for a moment. "The Quality Committee review," she said. "My statement is part of the record." "Yes." "Whatever they find, it goes where it goes." "Yes." Prescott looked at her chart. "I've been here 4 years," she said, in the voice of someone doing arithmetic rather than conversation. 4 years of knowing that what I saw mattered and that the system had a particular way of deciding it didn't." She paused. "That's a long time to be right about something that the record said was wrong." "It is," Nora said. "Does it get easier?" Prescott asked. And the way she asked it was not rhetorical. She actually wanted to know, the way people asked things when they'd decided to stop performing certainty. Nora thought about it honestly. "Not easier," she said. "Clearer. You get clear about which things are worth the cost, and what the cost actually is, as opposed to what it feels like before you pay it." Prescott looked at her for a moment. "That's not particularly comforting," she said. "No," Nora agreed, "but it's true." Something shifted in Prescott's expression. Not relief exactly, more like the particular settling that happened when someone heard an accurate thing instead of a comfortable one and recognized the difference. "I have rounds," Prescott said. "I know. I'll let you go." She was 2 steps away when Prescott said, "Voss." She turned. "Whatever the board recommends for you," Prescott said. "Whatever comes next. You should know. People saw what you did in the trauma bay. Both times, not just the outcome, the way you did it." She paused. "That matters. Even when nobody says it out loud." Nora held her gaze for a moment. "Thank you," she said. She meant it in every register the words could carry. 3 weeks after the board ruling, the Quality Committee completed its review. The findings confirmed what the complaints had alleged. The 2 cases of delayed diagnosis in the 6 months preceding Nora's arrival had involved nursing observations that went unaddressed, and that the pattern of dismissal documented in the complaints was a contributing factor in both cases. 1 patient had required additional intervention, 1 had been discharged without appropriate follow-up, and had returned to the ED 2 weeks later. The findings were submitted to the state licensing board. Holt's clinical supervision restrictions were extended pending the licensing board's review, which meant he remained at Callaway in an administrative capacity while the process completed its timeline. He did not contest the Quality Committee's findings. His legal counsel issued a statement on his behalf describing his commitment to collaborative patient care going forward, which was the language people used when the other language was no longer available. Bartlett resigned 4 days after the Quality Committee findings were published internally. She did not issue a statement. She was simply no longer in the building on the 5th day, and the staff absorbed her departure with the particular mixture of relief and the complicated sadness of having known someone for a long time and found out too late what that knowing had actually contained. The Stonehaven investigation produced formal charges against Grabble and 2 other procurement officers by the end of November. The IG's formal report identified a 3-year pattern of contract manipulation that had cost the installation's equipment budget a significant sum and had compromised supply quality for medical units in a way that had real-world consequences for the people those units treated. OC's documentation was central to the case. Her contractor status was formally commended in the IG's findings, which was the closest the institutional language could come to saying that someone had done something important at personal risk and that the institution noticed. She got a call from OSE on the last Tuesday of November. She was in her kitchen, bay outside, coffee in hand, the same configuration that had carried her through the complicated nights and the ones that weren't complicated but needed sitting with anyway. I heard you did something interesting in Virginia, Osei said. Her voice was the same as it had been 2 years ago. The voice of a woman who had calibrated everything she said and was very comfortable with the calibration. You arranged it, Nora said. I arranged a transport route, Osei said. Everything else was you. That's a narrow distinction. It's an accurate one. A pause. How are you? I'm fine, Nora said. Then, because Osei was not a person who accepted fine as a complete answer from people she knew, I'm figuring out what comes next. I know what comes next, Osei said. Of course you do. I'm not telling you what to do, Osei said. But the Installation Oversight Office has a position opening in January. Civilian contractor. It involves reviewing medical care standards at facilities that treat military personnel, identifying gaps, making recommendations. She paused. It involves being in rooms where people have very strong ideas about how things should run and presenting evidence that things should run differently. Nora looked at the bay. That sounds like a description of my last 3 weeks, she said. It does, Osei said, almost like you've been preparing for it. She drank her coffee. She thought about what Pruitt had written, the difference between choosing a quiet life and being put in one. She thought about Prescott's 4 years of being right about something the record said was wrong. She thought about Brower, who had been awake enough on the gurney to hear what was happening and had asked afterward for the blonde nurse. She thought about the coroner. Send me the position description, she said. Already sent, Osei said. 20 minutes ago. Of course it was. A warmth in Osei's voice that wasn't quite a laugh but was adjacent to one. Nora. Mara. You spent 2 years trying to be only a nurse, Osei said. I understand why. I'm not saying it was wrong, but there's a version of you that the world is actually better for having visible. Nora was quiet. I know, she said. And she did know. Had known, probably, since the moment she grabbed her stethoscope and moved to Brower's left side. Since the moment she said, this version creates problems, and Mercer said, this version solves them. She'd known it the way you knew things that cost something to act on, not ignorant of it, but keeping the knowledge in a drawer because the drawer was safer than the decision. The drawer was open now. I'll call you Thursday, Nora said. Wednesday, Osei said. I have Thursday full. She smiled. Wednesday. She ended the call. The last shift she worked as a floor nurse at Callaway Defense Medical Center before her administrative transition was a Thursday night, and it was quiet in the way that some nights were quiet. Not empty, but settled, the department running at the pace of a well-maintained thing doing what it was built to do. Jacinda found her at the end of it, in the supply room doing the inventory count that was technically someone else's job, which she'd been doing since Bartlett left because Bartlett had been the one who assigned it, and now nobody had assigned it, and it still needed doing. The position was posted internally today, Jacinda said. She was leaning in the doorway with her arms crossed, watching Nora count linen with the expression of someone who had a feeling about where this conversation was going. I know, Nora said. Trauma nursing specialist, expanded scope. They're building a new role. Someone made a recommendation to administration that the protocols needed to be restructured, and that restructuring should be led by someone with relevant background. The board recommended the protocol review, Nora said. Yes. And someone recommended the protocol review be led by someone specific. Jacinda tilted her head. The recommendation was anonymous, but dress call has been in this building 3 times in the last 2 weeks, so Nora put down her clipboard. I'm not taking that position, she said. Jacinda's expression shifted. What? I'm taking a civilian contractor role in January with installation medical oversight. She paused. But I recommended Prescott for the internal position. She has the clinical background, she has the institutional knowledge, and she understands exactly what the protocol gaps look like from the nursing side, because she's been living inside them for 4 years. Jacinda stared at her. You recommended Prescott. It was either her or you. I thought you'd say no. Jacinda laughed, a full, unguarded laugh, the kind that surprised her on the way out. I absolutely would have said no. She looked at Nora. Prescott doesn't know yet? She'll be notified tomorrow. Jacinda was quiet for a moment, processing the full shape of it. You're leaving, she said. Yes. Before you've been here 3 months. Yes. And you've completely rearranged this department, Jacinda said, not accusingly, but with the particular wonder of someone watching a thing and identifying it clearly for the first time. The department rearranged itself, Nora said. I was just in the room. That's not true, Jacinda said. That's the modest version. I've been here 6 years and nothing in this department moved until you arrived. Nora looked at her. Things were already wrong, she said. I didn't create the problem. I just stopped being one of the reasons it stayed invisible. It was Mercer's framing. But it was also true. Jacinda uncrossed her arms. She stood in the doorway for a moment with the expression of someone arriving at something they wanted to say and taking the time to say it right. I didn't know what you were, she said, when you came in. I watched you work and I thought, this is someone careful, someone very good at keeping herself small. She paused. I was wrong about the keeping herself small part. I was practicing, Nora said. Did it work? She thought about it. For a while, she said, and then it didn't, and that was probably how it was always going to go. She drove home that night through Hargrove Bay, which was the kind of small coastal city that looked different at night than it did in the day. More honest, the tourist-facing surfaces less prominent, the working infrastructure more visible. She drove past the water, which was black and silver under a half moon, and she felt the specific quality of a completed thing settling into its place in memory. Not everything had been resolved cleanly. Holt's licensing review would take months, and the outcome was uncertain. The Stonehaven investigation would take longer, and the full extent of the damage would take time to document. Prescott would step into a new role and find it harder than it looked, because new roles always were, and the department would go through the specific friction of restructuring protocols that people had been following for years. These were not clean resolutions. They were beginnings of longer processes that would be carried by other people in other rooms. That was how things actually worked, as opposed to how they looked from the outside. Not a single moment where everything clicked into place, but a series of smaller moments, each one creating the conditions for the next, each one requiring someone to be in the right room at the right time and to do the thing that the moment required. She had been in the room, she'd done the thing, the rest would follow at the pace things followed. She parked outside her apartment building and sat in the truck for a moment with the engine off, looking at the bay. She was 32 years old. She had a service record that existed in documents most people would never have clearance to read. She had a nursing license and 2 years of practice, and 3 weeks inside a hospital that had clarified something she hadn't been fully willing to look at directly since she'd left the operational world and tried to find out who she was without it. What she'd found was that the two things were not separate, that the person who had stayed calm under fire and the person who had stayed calm in a trauma bay, and the person who had sat in a conference room and said what she'd observed without decoration were the same person. That you could leave a life, but you couldn't leave yourself. And trying to was not peace, it was just a different kind of pressure. She got out of the truck. She looked at the water one more time. There was something she'd thought about, in the parts of the past 3 weeks where she hadn't been managing immediate situations. The thing Pruitt had written, and what Mercer had said, and the particular truth that Prescott had arrived at in a supply room on a Sunday afternoon, that doing the right thing twice was harder than doing it once, and that doing it twice was what actually built the record that couldn't be made invisible. She had been underestimated. She had been put in corners and given the minimum possible scope and told that her observations were above her station. She had absorbed that for a time because absorbing it was the path of least resistance, and she'd been tired enough to want least resistance. But resistance and diminishment were not the same thing. Staying quiet was sometimes tactical. Becoming invisible was something else. The difference was knowing which one you were doing and why, and whether the reason still held. Her reason had stopped holding somewhere around the moment she put her stethoscope on Brower's left side. She took the stairs to her apartment. She made coffee. She opened Osei's email with the position description and read it all the way through, this time without the ambient noise of everything else making it hard to hear. Then she typed a reply. 2 sentences. I'm interested. When can we talk? She hit send. She looked at the bay. The world had a way of needing exactly what you had been spending years trying to minimize, and the moment you stopped minimizing it, the world rearranged itself to use you. Not because you were exceptional in some abstract, elevated sense, because the particular combination of what you'd learned and survived and kept and carried was useful and real and not replaceable with something cleaner or more convenient. You could spend your career being managed down to a size that was comfortable for the people around you, and there was a version of a life in that, a functional version, not without value. Or you could stop. Nora Voss had stopped. She was not done being underestimated. That was not how the world worked, and anyone who told you otherwise was selling you something. There would be more rooms where people looked at her and made their calculations and arrived at conclusions that did not include what she actually was. There would be more moments where she had to decide whether the cost of being visible was worth paying. She had decided. The cost was worth paying, not because it was easy, not because it always worked, or because justice was guaranteed, or because the people who needed to understand would always understand in time, but because the alternative, the careful, practiced, deliberate erasure of your own capacity in exchange for a quieter life, cost something too, and that cost accumulated in ways that were harder to see but no less real. She had paid both costs. She knew which one she could live with. The bay was dark and the lights of Hargrove Bay were on the water in their broken shapes, and somewhere across it, in a hospital on the other side of town, Prescott was finishing a shift and would come in tomorrow to a notification that someone had recommended her for a role she didn't know she was going to be offered. And Brower was in outpatient recovery somewhere, doing his range of motion exercises. And Pruitt was back at whatever the work of a general was, moving through his days with a repaired graft and a phone number in his pocket that he'd given to a nurse because he'd understood, from a gurney, what she was. She drank her coffee. She was not a legend. She was not a myth. She was a 32-year-old woman with a complicated service record and a nursing license and 2 years of practicing being smaller than she was. And she had run out of reasons to keep practicing. That was enough. That was in fact everything. The people who had tried to make her invisible had not done it because they were cruel, most of them. They had done it because invisible people are easier to manage, and managed departments run more smoothly, and smoothly running departments made the people at their center feel competent and secure. The problem was that smooth running and good outcomes were not the same thing, and the gap between them was usually occupied by the people who saw the gap and said nothing. She had said something. And the room, slowly, imperfectly, over 3 weeks of friction and institutional process, and one woman walking into an administrative office before 8 in the morning to put something in writing for the second time, had rearranged itself. Not for her, not because of her alone, but because she had stopped being one of the reasons it couldn't. That distinction mattered. It was, she thought, the most important distinction there was, between the person who did the thing and the institution that made it necessary, and the space between them where ordinary people decided, in the moment, which version of themselves to bring to the problem. She had brought the real version. She would keep bringing it, whatever room came next.